ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗೆ ಅನ್ಯಾರಮ್ಮ. ಮೋರೆ ಕಪ್ಪಿನ ಭಾವ ಮೊರದ ಗಲದ ಕಿವಿ ಕೊರೆದಾಡಿ ಅನ್ಯಾರಮ್ಮ. ಮೋರೆ ಕಪ್ಪಿನ ಭಾವ ಮೊರದ ಗಲದ ಕಿವಿ ಕೊರೆದಾಡಿ ಅನ್ಯಾರಮ್ಮ. ಮೂರು ಕಣ್ಣಿನ ಸುತ್ತ ಮುರಿದಿಟ್ಟ ಚಂದ್ರನ, ಮೂರು ಕಣ್ಣಿನ ಸುತ್ತ ಮುರಿದಿಟ್ಟ ಚಂದ್ರನ ಧೀರತ ಗಣನಾಥನೇ ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗೆ ಅನ್ಯಾರಮ್ಮ. ರಾಶಿ ವಿದ್ಯೆಯ ಬಲ್ಲ ರಮಣಿ ಹಂಬಲನುಳ್ಳ ಭಾಷಿಗನಿವನ್ಯಾರಮ್ಮ. ಲೇಸಾಗಿ ಜನರ ಸಲಹುವ ಕಾಗಿ ನೆಲೆಯಾದಿ, ಲೇಸಾಗಿ ಜನರ ಸಲಹುವ ಕಾಗಿ ನೆಲೆಯಾದಿ ಕೇಶವದಾಸ ಕಣೆ ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗೆ ಅನ್ಯಾರಮ್ಮ. ನಿಮ್ಮೊಳಗೆ ಅನ್ಯಾರಮ್ಮ, ನಿಮ್ಮೊಳಗೆ ಅನ್ಯಾರಮ್ಮ.
Thank you, Vishnu, for creating an heavenly atmosphere. Presence of so many distinguished guests on this occasion is a pleasure for all of us. Now, I request our respected chairperson, Professor Mrs. Malini, to accord a ceremonial welcome to our guests.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರಗಳು. ಮೈಸೂರು ಯೂನಿವರ್ಸಿಟಿಗೆ ತಮ್ಮೆಲ್ಲರಿಗೂ ಆದರದ ಸ್ವಾಗತ. ಇಂದು ವಿಶ್ವ ಕ್ಯಾನ್ಸರ್ ದಿನವನ್ನ ಇಡೀ ವಿಶ್ವದಾದ್ಯಂತ ಆಚರಣೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಕ್ಯಾನ್ಸರ್ ಅಂದ ತಕ್ಷಣ ಎಂತ ಗುಂಡಿಗೆ ಇರೋರ್ಗುನು ಆ ಒಂದು ಪದ ಕೇಳಿದ ತಕ್ಷಣ ಎಲ್ಲೋ ಒಂದು ಚಳಿ ಬರುತ್ತೆ. ಆ ಕ್ಯಾನ್ಸರ್ ಪಾಸಿಟಿವ್, ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ ಅಂದ ತಕ್ಷಣ ಅವರು ನಿಜವಾಗ್ಲೂ ಬಹಳ ಜೀವನದಲ್ಲಿ ಕುಗ್ಗೋಗ್ತಾರೆ. ಹಾಗಾಗಿ ಇತ್ತೀಚಿನ ದಿನದಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಅನ್ನೋದು ಒಂದು ಮಹಾಮಾರಿಯಾಗಿ ಕಾಣ್ತಾ ಇದೆ. 70ರ ದಶಕದಲ್ಲಿ ಹೆಸರಿಲ್ಲದಂತ ಈ ಒಂದು ಕಾಯಿಲೆ ಇತ್ತೀಚಿನ ದಿನದಲ್ಲಿ ಎಲ್ಲಾ ಕಡೆ ಈವನ್ ಒಂದು ಕುಟುಂಬದಲ್ಲೂ ಸಹ ನಾವು ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಹಾಗಾಗಿ ಇದರ ಬಗ್ಗೆ ಒಂದು ಅರಿವಿನ ಕಾರ್ಯಕ್ರಮನ ಮಾಡಬೇಕು. ಅದರಲ್ಲೂ ಮುಖ್ಯವಾಗಿ ನಮ್ಮ ಟೀಚರ್ಸ್ ಗಳಿಗೆ ನಾವು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನ ಮಾಡೋದ್ರಿಂದ ಅವರು ಇನ್ನೂ 10 ಜನಕ್ಕೆ ಮಕ್ಕಳಿಗೆ ಅದರ ಬಗ್ಗೆ ತಿಳಿಸ್ತಾರೆ. ಒಂದು ಸಮಾಜಕ್ಕೆ ಅವರು ಇದರ ಬಗ್ಗೆ ಒಂದು ಅರಿವನ್ನು ನೀಡೋದ್ರಿಂದ ಟೀಚರ್ಸ್ ಆಫ್ ದ ಟಾರ್ಗೆಟ್ ಗ್ರೂಪ್ ನಮ್ಗೆ. ಹಾಗಾಗಿ ಅವರನ್ನು ಉದ್ದೇಶಿಸಿ ಈ ಒಂದು ದಿನದ ಕಾರ್ಯಕ್ರಮವನ್ನ ನಾವು ಆಚರಣೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಹಾಗಾಗಿ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಈ ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿದವರು ಪ್ರೊಫೆಸರ್ ಎಚ್ ರಾಜಶೇಖರ್ ಅವರು. ಇವರು ಕುಲಪತಿಗಳು, ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ. ನಮ್ಮ ಕೈಗೆ ಹೋಗೊಟ್ಟು ಅವರ ಬಿಡುವಿಲ್ಲದ ಸಮಯದಲ್ಲೂ ಸಹ ಕುಲಪತಿಗಳು ಇಂದು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಹಾಜರಾಗಿದ್ದಾರೆ. ಅವರನ್ನು ತಮಗೆಲ್ಲರಿಗೂ ಪರಿಚಯ ಮಾಡಿಸೋದು ನನ್ನ ಆದ್ಯ ಕರ್ತವ್ಯ. Dr. H. Rajashekar, PhD in the area of specialization is corporate governance and business ethics, and he also served as the coordinator of KSET UGC, University of Mysore, and he also served as the director EMRC, University of Mysore, from 2016. And sir has got very extensive teaching experience, about 25 years. And sir has published 7 books, and he has attended many conferences, seminars, workshops, etc. More than 25 international conferences and 39 to 40 national conferences. And sir also guided many students, around 20 students got a PhD degree under his able guidance. And sir has published research articles around 52. And for all his work, he has awarded and honored and Bharat Gaurav Award for outstanding services, achievement, and contribution. And that's by Indian International Friendship Society in New Delhi. And he also honored Bharat Excellence Award. And he served as a national coordinator for MOOC course, that is a UGC, hosted and successfully completed 21 MOOC courses online from January 2019. And sir served in a different discipline as a chairperson of Department of Commerce. Then Secretary, University of Mysore, Centenary Celebration, Treasurer for the University of Mysore, Joint Secretary in 103rd Indian Science Congress 2016, and in a different discipline as a chairperson of BOS, BOE, and many other disciplines. With this brief introduction, I welcome you, sir. And ಈ ಒಂದು ಅವರನ್ನ ಎಲ್ಲರಿಗೂ ಪರಿಚಯ ಮಾಡ್ಕೊಳ್ಳೋದು ತುಂಬಾ ಸಂತೋಷ ಆಗ್ತಾ ಇದೆ. ಸರ್ನ ಬಹಳ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಕ್ಕೆ ಸುಮಾರು ಸಲ ಪ್ರಯತ್ನ ಪಟ್ಟಿದ್ದೆ, ಆದ್ರೆ ಆಗ್ಲಿಲ್ಲ. ಆದ್ರೆ ಬರೀ ಒಂದು ಮೆಸೇಜ್ ಮತ್ತೆ ಅವರ ಆಫೀಸ್ ಥ್ರೂ ಒಂದು ಕಾಂಟ್ಯಾಕ್ಟ್ ಅಲ್ಲೇ ಸರ್ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿದ್ದಾರೆ. ಹಾಗಾಗಿ ಎಲ್ಲರ ಪರವಾಗಿ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸ್ಟಡೀಸ್ ಇನ್ ಜೆನೆಟಿಕ್ಸ್ ಅಂಡ್ ಜೀನೋಮಿಕ್ಸ್ ಹಾರ್ಟ್ಲಿ ವೆಲ್ಕಮ್ ಟು ಯು ಸರ್. ಮತ್ತೊಬ್ಬ ಅತಿಥಿ ಅವರು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಲ್ಪ ತಡವಾಗಿ ನಮ್ಮನ್ನು ಜಾಯಿನ್ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಅವರು ಶ್ರೀ ನಾಗಮಲ್ಲೇಶ್, ಅವರು ಉಪನಿರ್ದೇಶಕರು, ಪದವಿ ಪೂರ್ವ ಶಿಕ್ಷಣ ಇಲಾಖೆ. ಅವರ ಒಂದು ಪರಿಚಯನ ತಮಗೆ ಮಾಡಿಕೊಡ್ತಾ ಇದ್ದೀನಿ. ಅವರು ಅಲ್ಯೂಮಿನಿ ಆಫ್ ಯೂನಿವರ್ಸಿಟಿ ಆಫ್ ಮೈಸೂರು. ಅವರು ತಮ್ಮ ಪದವಿಯನ್ನು ಯುವರಾಜ ಕಾಲೇಜಿನಲ್ಲಿ ಮುಗಿಸಿರ್ತಾರೆ. ಸ್ನಾತಕೋತ್ತರ ಪದವಿಯನ್ನು ಸಸ್ಯಶಾಸ್ತ್ರ ವಿಭಾಗ ಮಾನಸ ಗಂಗೋತ್ರಿಯಲ್ಲಿ ಅವರು ಮುಗಿಸಿರ್ತಾರೆ. ಆ ನಂತರ ಅವರು ಪ್ರಥಮ ಬಾರಿಗೆ ಉಪನ್ಯಾಸಕರಾಗಿ 1993ರಲ್ಲಿ ಕೊಳ್ಳೇಗಾಲದಲ್ಲಿ ನೇಮಕಗೊಂಡು ಅಲ್ಲಿ ಪದವಿ ಪೂರ್ವ ಕಾಲೇಜಿನಲ್ಲಿ ಕರ್ತವ್ಯ 1996ರವರೆಗೆ ಕರ್ತವ್ಯ ನಿರ್ವಹಣೆ ಮಾಡಿರ್ತಾರೆ. ನಂತರದ ದಿನಗಳಲ್ಲಿ ಅವರು ಇನ್ನು ಬೇರೆ ಬೇರೆ ನೆಲಮಂಗಲ ತಾಲೂಕಿನಲ್ಲಿ ಸಹ ಕೆಲಸ ಮಾಡಿದ್ದಾರೆ, KR ಪೇಟೆ ತಾಲೂಕು, ಹಾಗೆ ವಿಠಲಪುರ ಅದು ಪದವಿ ಸರ್ಕಾರಿ ಪದವಿ ಕಾಲೇಜು, ಇಲ್ಲೆಲ್ಲ ಉಪನ್ಯಾಸಕರಾಗಿ ಕೆಲಸನ ನಿರ್ವಹಿಸಿರ್ತಾರೆ. ನಂತರದ ದಿನದಲ್ಲಿ ಅವರು ಪ್ರಾಂಶುಪಾಲರಾಗಿ ಒಂದು ಬಡ್ತಿಯನ್ನ ಹೊಂದು ನಂತರ 2021ರ ಆಗಸ್ಟ್ ನಿಂದ ಪೂರ್ವಕಾಲೀನ ಉಪನಿರ್ದೇಶಕರಾಗಿ ಪದೋನ್ನತಿಯನ್ನ ಪಡೆದು ಉಪನಿರ್ದೇಶಕರ ಕಚೇರಿ ಪದವಿ ಪೂರ್ವ ಶಿಕ್ಷಣ ಇಲಾಖೆ ಚಾಮರಾಜನಗರ ಜಿಲ್ಲೆ ಇಲ್ಲಿ ಇವರು ಕಾರ್ಯವನ್ನ ನಿರ್ವಹಿಸ್ತಾ ಇದ್ದಾರೆ. ಸರ ಒಂದು ಸಹಕಾರದಿಂದಾಗಿ ಈ ಒಂದು ದಿನ ನಾವು ವಿಶ್ವ ಒಂದು ಕ್ಯಾನ್ಸರ್ ದಿನಾಚರಣೆಯನ್ನ ನಾವು ಆಚರಣೆ ಮಾಡೋದು ಸಾಧ್ಯ ಆಗ್ತಾ ಇದೆ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಅವರು ತಮ್ಮ ಕಾಲೇಜಿನ ಉಪನ್ಯಾಸಕರುಗಳನ್ನ ಈ ಒಂದು ಕಾರ್ಯಾಗಾರಕ್ಕೆ ಅವರು ಡೆಪ್ಯೂಟ್ ಮಾಡಿರ್ತಾರೆ. ಹಾಗಾಗಿ ಎಲ್ಲರ ಪರವಾಗಿ ನಾನು ಅವರ ಶಾರ್ಟ್ಲಿ ಹಿ ವಿಲ್ ಬಿ ಜಾಯ್ನಿಂಗ್, ಅವರಿಗೆ ಎಲ್ಲರ ಪರವಾಗಿ ಒಂದು ಸ್ವಾಗತವನ್ನ ಬಯಸ್ತಾ ಇದ್ದೀನಿ. ಗಿರೀಶ್ ಇವರು ನನ್ನ ಸಹಪಾಠಿಗಳು. ಇವರು ಹುಣಸೂರಿನ ಸರ್ಕಾರಿ ಪದವಿ ಪೂರ್ವ ಕಾಲೇಜಿನಲ್ಲಿ ಉಪನ್ಯಾಸಕರಾಗಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ವಿದ್ಯಾರ್ಥಿ ದೆಸೆಯಿಂದಲೂ ಸಹ ತುಂಬಾ ಒಂದು ಕಾರ್ಯ ಚಟುವಟಿಕೆಯಿಂದ ಕೂಡಿದಂತಹ ವಿದ್ಯಾರ್ಥಿ. ಇವರ ಒಂದು ಏಡ್ಸಮ್ಮ ಅನ್ನೋ ಒಂದು ಟೆಂಪಲ್ ನಿಜವಾಗ್ಲೂ ಒಬ್ಬ ಸರ್ಕಾರಿ ಕೆಲಸದಲ್ಲಿರುವಂತಹ ಒಬ್ಬ ಪ್ರಾಧ್ಯಾಪಕ ಅಥವಾ ಉಪನ್ಯಾಸಕ ಅಥವಾ ಶಿಕ್ಷಕ ಮನಸ್ಸು ಮಾಡಿದ್ರೆ, ಇಚ್ಛಾಶಕ್ತಿ ಇದ್ರೆ ಏನ್ ಬೇಕಾದ್ರೂ ಮಾಡಬಹುದು. ಒಂದು ಲಿಮಿಟೆಡ್ ಸೋರ್ಸಸ್ ಅಲ್ಲಿ ಅದಕ್ಕೆ ಇವರೇ ಒಂದು ಜೀವಂತ ಸಾಕ್ಷಿ ಅಂತ ಅನ್ಬೋದು, ಉದಾಹರಣೆ ಅಂತ ಅನ್ಬೋದು. ಏನಕ್ಕೆ ಅಂತಂದ್ರೆ ಇವರು ಆ ಒಂದು ಏಡ್ಸಮ್ಮ ಅನ್ನೋ ಒಂದು ಟೆಂಪಲ್ ನ ಮುಖಾಂತರ ಜನರಲ್ಲಿ ಏಡ್ಸ್ ಬಗ್ಗೆ ಒಂದು ಜಾಗೃತಿಯನ್ನ ಮೂಡಿಸಿದ್ರು. ಅದರ ವಿಶೇಷತೆ ಏನಂತಂದ್ರೆ ಈ ಒಂದು ಕಾರ್ಯದನ್ನ ನೋಡಿ ಅದನ್ನ ಶ್ಲಾಘನೆ ಮಾಡೋದಕ್ಕೆ ಹಾರ್ವರ್ಡ್ ಯೂನಿವರ್ಸಿಟಿಯಿಂದ ರಿಸರ್ಚ್ ಸ್ಕಾಲರ್ಸ್ ಬಂದು ಆ ಒಂದು ಸಣ್ಣ ಹಳ್ಳಿಯಲ್ಲಿ ಉಳ್ಕೊಂಡು ಅವರು ತಮ್ಮ PhD ಯನ್ನ ಮುಗಿಸಿದ್ರು. BBC-ಯಲ್ಲಿ ಇವರ ಪ್ರೋಗ್ರಾಮ್ಗಳೆಲ್ಲ ಟೆಲಿಕಾಸ್ಟ್ ಆಯ್ತು. ಅಂದ್ರೆ ಯಾವುದೇ ಒಂದು ರಿಸೋರ್ಸ್ ಇಲ್ಲದೆ, ಸಪೋರ್ಟ್ ಇಲ್ಲದೆ, ಇಚ್ಛಾಶಕ್ತಿ ಇದ್ರೆ ಮನುಷ್ಯನಿಗೆ ಅವನು ಏನ್ ಬೇಕಾದ್ರೂ ಸಾಧನೆ ಮಾಡಬಹುದು ಅನ್ನೋದಕ್ಕೆ ಇವರೇ ಒಂದು ಜ್ವಲಂತ ಸಾಕ್ಷಿ. ಹಾಗಾಗಿ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಅವರ ಸಂಪೂರ್ಣ ಸಹಕಾರದಿಂದ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನ ನಾವು ಈ ದಿನ ಹಮ್ಮಿಕೊಂಡಿದ್ದೀವಿ. ಹಾಗಾಗಿ ಅವರಿಗೆ ಎಲ್ಲರ ಪರವಾಗಿ ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ಹಾಗೂ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಜೆನೆಟಿಕ್ಸ್ ಅಂಡ್ ಜೀನೋಮಿಕ್ಸ್ ಮತ್ತೆ ಎಲ್ಲರ ಪರವಾಗಿ ನಾನು ಅವರಿಗೆ ಸ್ವಾಗತವನ್ನ ಬಯಸ್ತಾ ಇದ್ದೀನಿ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಸಹ ಚೆನ್ನಾಗಿ ನಡಿಬೇಕು ಅಂತಂದ್ರೆ ನಮ್ಮ ವಿಭಾಗದ ಇತರ ಉಪನ್ಯಾಸಕರುಗಳು ಮತ್ತೆ ನಮ್ಮ ಗುರುಗಳು ಇವರೆಲ್ಲರ ಒಂದು ಪ್ರೆಸೆನ್ಸ್ ಅಥವಾ ಒಂದು ಏನೋ ಒಂದು ಆಶೀರ್ವಾದ ಅದು ಮುಖ್ಯ. ಇಲ್ಲಿ ಇಲ್ಲಿನ ಡಾಕ್ಟರ್ NP ರಾಮಚಂದ್ರ ಇವರು ನಮ್ಮ ಗುರುಗಳು, ನನಗೆ ಗಿರೀಶ್ ಇಬ್ಬರಿಗೂ ಗುರುಗಳು ಹಾಗೂ ನನ್ನ PhD ಮಾರ್ಗದರ್ಶಕರು ಸಹ ಆಗಿದ್ದಾರೆ. ವಿಭಾಗದಲ್ಲಿ ಅವರು ಪ್ರಥಮ ಅಧ್ಯಕ್ಷರಾಗಿ ಸಹ ಕಾರ್ಯವನ್ನು ನಿರ್ವಹಿಸಿದ್ರು. ಅವರಿಗೆ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದ ಪರವಾಗಿ ನಾನು ಸ್ವಾಗತವನ್ನ ಬಯಸ್ತಾ ಇದ್ದೀನಿ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ರಿಸೋರ್ಸ್ ಪರ್ಸನ್ ಆಗಿ ಡಾಕ್ಟರ್ PK ಕಿರಣ್ ಬಂದಿದ್ದಾರೆ, ಕ್ಯಾನ್ಸರ್ ರೋಗ ತಜ್ಞರು, JSS ಹಾಸ್ಪಿಟಲ್ ಮೈಸೂರು. ಇವರಿಗೆ ಈ ಕಾರ್ಯಕ್ರಮದ ಪರವಾಗಿ ಸ್ವಾಗತ. ಡಾಕ್ಟರ್ ಶಿವಾನಂದ್ ಮನೋಹರ್ ಅವರು ಮನೋರೋಗ ತಜ್ಞರು, JSS ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯ, ಅವರು ಸಹ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬರ್ತಾ ಇದ್ದಾರೆ. ಅವರಿಗೂ ಸಹ ಎಲ್ಲರ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನ ಬಯಸ್ತೀನಿ. ಡಾಕ್ಟರ್ ಶ್ಯಾಮ್ ಸುಂದರ್ ನಿವೃತ್ತ ಪ್ರಾಧ್ಯಾಪಕರು, ಅಂಗರಚನಾ ಶಾಸ್ತ್ರ ವಿಭಾಗ, JSS ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯ. ಅವರು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಈ ಒಂದು ಟ್ಯೂಮರ್ಸ್ ಅಥವಾ ಕ್ಯಾನ್ಸರ್ ಗೆಡ್ಡೆಗಳ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಯಾವ್ಯಾವ್ದು ಕ್ಯಾನ್ಸರ್ ಬರಬಹುದು ಆ ಎಲ್ಲಾ ಕ್ಯಾನ್ಸರ್ ಮತ್ತೆ ಅದು ನಾರ್ಮಲ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಕ್ಯಾನ್ಸರ್ ಗೆಡ್ಡೆಗಳು ಏನಿದೆ ಅದರ ಒಂದು ಪ್ರಾತ್ಯಕ್ಷಿಕೆ ಅಥವಾ ಎಕ್ಸಿಬಿಷನ್ ನ ಅವರ ಒಂದು ಸಹಕಾರದಿಂದ ನಾವು ನಡೆಸ್ತಾ ಇದ್ದೀವಿ. ಅದರಲ್ಲಿ ಅವರು ಭಾಗಿಯಾಗಿದ್ದಾರೆ ಮತ್ತು ಅವರು ಅದನ್ನ ಎಲ್ಲ ಅರೇಂಜ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಹಾಗಾಗಿ ಅವರ ಒಂದು ಸಂಪೂರ್ಣ ಸಹಕಾರ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕಿದೆ. ಅವರಿಗೆ ಎಲ್ಲರ ಪರವಾಗಿ ನಾನು ಸ್ವಾಗತವನ್ನ ಬಯಸ್ತಾ ಇದ್ದೀನಿ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮುಖ್ಯ ಕೇಂದ್ರ ಬಿಂದುಗಳು ಪಾರ್ಟಿಸಿಪೆಂಟ್ಸ್. ನೀವೆಲ್ಲ ನಮ್ಮ ಕರೆಗೆ ಓಗೊಟ್ಟು ಬಂದಿದ್ದೀರಾ. ಖಂಡಿತವಾಗ್ಲೂ ನಿಮ್ಗೆ ಈ ದಿನ ನಿರಾಶೆ ಆಗೋದಿಲ್ಲ. ಅಟ್ ದ ಎಂಡ್ ಆಫ್ ದ ಡೇ ನೀವು ಹೋಗ್ಬೇಕಾದ್ರೆ ನಿಮ್ಗೆ ಅನ್ಸುತ್ತೆ ನಾವು ಎಷ್ಟೊಂದು ವಿಚಾರ ತಿಳ್ಕೊಂಡು ಅಂತ. ಆ ಒಂದು ಫೀಲಿಂಗ್ ನಿಮ್ಗೆ ಖಂಡಿತ ನಾವು ಕೊಡ್ತೀವಿ ಅಂತ ಹೇಳಿ ನಾನು ಕೇಳ್ಕೊಂತೀನಿ. ಹಾಗಾಗಿ ಕಾರ್ಯಕ್ರಮದ ಪರವಾಗಿ ಎಲ್ಲರಿಗೂ ನಾನು ಸ್ವಾಗತವನ್ನ ಬಯಸ್ತಾ ಇದ್ದೀನಿ. ಇದರ ಜೊತೆಗೆ ಮಿಷನ್ ಹಾಸ್ಪಿಟಲ್ ನ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮತ್ತೆ ಆ ಪ್ರಾಧ್ಯಾಪಕರುಗಳು ಸಹ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿದ್ದಾರೆ. ಅವರಿಗೂ ಸಹ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ವಿಭಾಗದ ಎಲ್ಲರೂ ನಮ್ಮ ಮುಖ್ಯವಾಗಿ ವಿದ್ಯಾರ್ಥಿಗಳು ಮತ್ತೆ ಬೋಧಕೇತರ ವರ್ಗದವರು ಇವರೆಲ್ಲ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿದ್ದಾರೆ. ಹಾಗಾಗಿ ಎಲ್ಲರಿಗೂ ನಾನು ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಪರವಾಗಿ ಹಾಗೂ ವಿಭಾಗದ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನು ಬಯಸ್ತಾ ಇದ್ದೀನಿ. ನಮಸ್ಕಾರ.
Thank you, ma'am. I take an immense delight in welcoming our chairperson, Professor S.S. Malini, chairperson and professor in Department of Genetics and Genomics. It is an honor to have you here with us, ma'am. Deepam Jyoti Parabrahma, Deepam Sarvatokapaka, Deepena Sadyate Sarvam, Sandhya Deepa Namoste. With that, ladies and gentlemen, I'd like to say that light and brightness has always been equated with positivity and motivation, and is seen as a harbinger of good. May I please request the dignitaries to lamp the light and symbolically inaugurate the program. Thank you, Rehan. H.M. Girish, lecturer in biology at Girls Government PU College, Humsuru. He has 30 years of teaching experience. Apart from teaching, he has been involved in various social work. His very unique way of AIDS awareness by creating Goddess AIDS Amma Temple, which has built in 1998. It gained worldwide attention and it has been research tool for Harvard University, USA. Biology NCERT book translated to regional language by him in 2019 and recipient of many awards, including the State Best Lecturer Award. I'd like to ask H.M. Girish to please speak a few words about the program.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಈ ದಿನ ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷರ ವಹಿಸಿಕೊಂಡಿರ್ತಕ್ಕಂಥ ಮಾನ್ಯ ಕುಲಪತಿಗಳಾದಂಥ ಎಚ್ ರಾಜಶೇಖರ್ ಸರ್ ಅವರೇ, ನನ್ನ ಮಾರ್ಗದರ್ಶಕರು, ನನ್ನ ಉಪನ್ಯಾಸಕರು ಆದಂತಹ ನಮ್ಮ ಡಾಕ್ಟರ್ ಎನ್ ಬಿ ರಾಮಚಂದ್ರ ಸರ್ ಅವರೇ, ಈ ಕಾರ್ಯಕ್ರಮದ ಮುಖ್ಯ ರೂವಾರಿಗಳು ಆದಂತಹ ಎಸ್ ಎಸ್ ಮಾಲಿನಿ ಮೇಡಮ್ ಅವರೇ, ಹಾಗೂ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಭಾಗವಹಿಸಿರ್ತಕ್ಕಂಥ ಸಂಪನ್ಮೂಲ ವ್ಯಕ್ತಿಗಳಾದ ಆಂಕಾಲಜಿಸ್ಟ್ ಕಿರಣ್ ಸರ್ ಅವರೇ, ಶಿವಾನಂದ್ ಸರ್ ಅವರೇ, ಶ್ಯಾಮ್ ಸುಂದರ್ ಸರ್ ಅವರೇ, ಹಾಗೂ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಶಿಬಿರಾರ್ಥಿಗಳಾಗಿ ಆಗಮಿಸಿರ್ತಕ್ಕಂಥ ಮೈಸೂರು ಜಿಲ್ಲೆಯ ಎಲ್ಲ ಪದವಿ ಪೂರ್ವ ಶಿಕ್ಷಣ ಇಲಾಖೆಯ ಉಪನ್ಯಾಸಕ ಬಂಧುಗಳೇ, ಹಾಗೂ ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿನಿಯರು, ಇವತ್ತು ಫೆಬ್ರವರಿ 4, 2023 ಅಲ್ಲಿ ನಾವು ವಿಶ್ವ ಕ್ಯಾನ್ಸರ್ ದಿನಾಚರಣೆ ಆಚರಿಸ್ತಾ ಇದೀವಿ. ಇದು ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಸಹಯೋಗದೊಂದಿಗೆ ನಾವು ಮಾಡ್ತಾ ಇರ್ತಕ್ಕಂಥ 2ನೇ ಕಾರ್ಯಕ್ರಮ. ಈ ಮುಂಚೆ ನಾವು ಜನವರಿ 7ನೇ ತಾರೀಕು ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಸಹಯೋಗದೊಂದಿಗೆ ನಾವು ಹೈಸ್ಕೂಲ್ ಟೀಚರ್ಸ್ಗೆ ಸುಮಾರು 250 ಪ್ರಾಥಮಿಕ ಹಾಗೂ ಪ್ರೌಢಶಾಲಾ ಶಿಕ್ಷಕರಿಗೆ ನಾವು ಒಂದು ಓರಿಯಂಟೇಶನ್ ಟ್ರೈನಿಂಗ್ ಕೊಟ್ಟಿದ್ವಿ. ಅದು ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ. ಈ ಸಾರಿ ಎಸ್ಪೆಷಲಿ 2023-24 ಅಲ್ಲಿ ಮಕ್ಕಳು ಹೇಗೆ ಅಕಾಡೆಮಿಕ್ ಅಲ್ಲಿ ಹಿನ್ನಡೆ ಆಗಿದೆ, ಸ್ಪೆಷಲಿ ಆಫ್ಟರ್ ಕೋವಿಡ್ ಮಕ್ಕಳ ದೈಹಿಕ ಅಡೋಲಸೆನ್ಸ್ ಮತ್ತು ಈ ಮೊಬೈಲ್ ಅಡಿಕ್ಷನ್ ಇಂದಾಗಿ ಮಕ್ಕಳ ಶೈಕ್ಷಣಿಕ ಪ್ರಗತಿ ಕುಂಠಿತ ಆಗಿದೆ ಅನ್ನೋ ದೃಷ್ಟಿಯಿಂದ ನಾವು ಮೈಸೂರು ಜಿಲ್ಲೆಯ ಆಯ್ದ ಸರ್ಕಾರಿ ಶಾಲೆಗಳ 250 ಶಿಕ್ಷಕರಿಗೆ ನಾವು ಒಂದು ಕೌನ್ಸಿಲಿಂಗ್ ಓರಿಯಂಟೇಶನ್ ಟ್ರೈನಿಂಗ್ ಅನ್ನ ಕೊಟ್ಟಿದ್ವಿ. ಅದಾದ ನಂತರ ನಾವು ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾಲಯದ ಏಡ್ಸ್ ಜಾಗೃತಿಗಾಗಿ ನಾವು ಯೂಟ್ಯೂಬ್ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬಂದಾಗ ಒಂದು ಸಮಸ್ಯೆ ಎದುರಾಯ್ತು. ಹಾಗಾಗಿ ಸ್ಪೆಷಲಿ ಮೈಸೂರು ಜಿಲ್ಲೆ ಇನ್ನೂ ಸೇರಿದಂತೆ ಕರ್ನಾಟಕದ ಎಲ್ಲಾ ಜಿಲ್ಲೆಗಳಿಂದ ಪ್ರಾಥಮಿಕ ಶಾಲಾ ಮತ್ತು ಪ್ರೌಢಶಾಲೆ ಹಾಗೂ ಜೂನಿಯರ್ ಕಾಲೇಜು, ಹೈಸ್ಕೂಲ್ ಅಲ್ಲದೆ ಪದವಿ ಕಾಲೇಜುಗಳಲ್ಲಿ ಕೌನ್ಸಿಲಿಂಗ್, ಟೀಚರ್ಸ್ ಟ್ರಾನ್ಸ್ಫರ್ಸ್ ಕೌನ್ಸಿಲಿಂಗ್ ಅಲ್ಲಿ ನಾವು ಅಪ್ಲಿಕೇಶನ್ ಡೇಟಾಗಳನ್ನ ತಗೊಂಡಾಗ ನಮ್ಗೆ ಗೊತ್ತಾಯ್ತು, ಸುಮಾರು 40% ಶಿಕ್ಷಕರು ವರ್ಗಾವಣೆಯನ್ನ ಬಯಸಿದ ಆರೋಗ್ಯ ಸಿವಿಯರ್ ಕ್ರಾನಿಕಲ್ ಇಲ್ನೆಸ್ ಅನ್ನೋ ಕಾಲಮಲ್ಲಿ ಅವರು ಸುಮಾರು 40% ಟೋಟಲ್ ಆಸ್ಪಿರೆಂಟ್ಸ್ ಇದ್ರು ಅನ್ನೋದು ನಮ್ಗೆ ಗೊತ್ತಾಗಿ, ಈ ಟೀಚರ್ಸ್ಗೆ ಸ್ಪೆಷಲಿ ನಾವು ಹೈಸ್ಕೂಲ್ ನಂತರದ ಪ್ರೌಢಶಾಲೆ ಮುಗಿದು ಬಂದಂತಹ ಪ್ರಿ ಯೂನಿವರ್ಸಿಟಿ ಉಪನ್ಯಾಸಕರಿಗೆ ಯಾವ್ದಾದ್ರು ಒಂದು ಓರಿಯಂಟೇಶನ್ ಟ್ರೈನಿಂಗ್ ಕೊಡ್ಬೇಕು ಅಂತ ಹೇಳಿ ನಾವು ಚಿಂತನೆ ಮಾಡಿದಾಗ ನಮ್ದು ಇದು ಕಾರ್ಯಗತವನ್ನ ಮಾಡ್ಕೊಂಡ್ವಿ. ಹಾಗಾಗಿ 2023ರ ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಸ್ಟಾರ್ಟ್ ಆಗಿದ್ದು 2000ದಿಂದ, ಅದು ಸುಮಾರು 10 ವರ್ಷಗಳ ಸಮಯ ಆಯ್ತು. ಇದು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ಸ್ಪೆಷಲಿ ಫ್ಲಾರಿಡಾದಲ್ಲಿ ಸ್ಟಾರ್ಟ್ ಆಯ್ತು. ಈ ವರ್ಷದ ಪಂಚ ಕ್ಲೋಸ್ ದಿ ಗ್ಯಾಪ್, ಕೇರ್ ದಿ ಗ್ಯಾಪ್ ಅಂತ ಹೇಳಿ, ಅಂದ್ರೆ ಆರೈಕೆಯ ಅವಧಿಯನ್ನ ಕಡಿಮೆ ಮಾಡ್ಬೇಕು ಆ ಗ್ಯಾಪ್ ಅನ್ನ ಅಂತ ಹೇಳಿ ಇದು ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಅದ್ರ ಜೊತೆಗೆ ಈ ಪ್ರೋಗ್ರಾಮ್ ಅನ್ನ ನಾವು ಏನಕ್ಕೆ ಈ ಕಾರ್ಯಕ್ರಮನ ಇಲ್ಲೇ ಆಯೋಜಿಸ್ತಾ ಇದೀವಿ ಅನ್ನೋದು ಅಲ್ಲದೆ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ಮುಖ್ಯವಾಗಿ 3 ಕೋಇನ್ಸಿಡೆನ್ಸ್ ಗಳಾಗ್ತಾ ಇದೆ. ಇದು ಮೊದಲನೇದಾಗಿ 25 ವರ್ಷಗಳ BRCA ಅಂತ ಒಂದು ಜೀನ್ ಅನ್ನ ಐಡೆಂಟಿಫೈ ಮಾಡಿದ್ದ 20ನೇ ವರ್ಷದ ವಾರ್ಷಿಕೋತ್ಸವ ಕೂಡ ಇದೆ. ಅದಲ್ಲದೆ ವಿಶ್ವ ಮಟ್ಟದ ಜಿಲ್ಲಿನ ನೀವು ಬೋರ್ಡ್ ಅಲ್ಲಿ ನೋಡ್ತಾ ಇದ್ದೀರಾ ನೀವು, ಎನ್ರಿಟಾ ಲ್ಯಾಕ್ಸ್ ಅಂತಕ್ಕಂಥ ಆಫ್ರಿಕನ್ ಅಮೆರಿಕನ್ ಮಹಿಳೆ, ಶಿ ಇಸ್ ಸಿಂಡ್ರಿಲ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಕರೀತಾರೆ. ಸಿಂಡ್ರಿಲ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಯಾಕೆ ಕರೀತಾ ಇದ್ದೀವಿ ಅಂದ್ರೆ, ಇದ್ರ ಬಗ್ಗೆ ನಾವು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ಮಟ್ಟ ಮತ್ತು ನಮ್ಮ ಪ್ರಿ ಯೂನಿವರ್ಸಿಟಿಯಲ್ಲಿ ನಾವು ಇದರ ಬಗ್ಗೆ ಒಂದು ಓರಿಯಂಟೇಶನ್ ಟ್ರೈನಿಂಗ್ ನ ಮಾಡ್ಬೇಕು ಅಂತ ಮಾಡ್ಕೊಂಡಿದ್ವಿ. ಅದರ ಮುಂದಿನ ಭಾಗವೇ ಇದು. ಈಕೆ 1951ರಲ್ಲಿ ಮರಣ ಹೊಂದಿದಾಗ ಅವರ ಡಾಕ್ಟರ್, ಆಕ್ಚುಲಿ ಶಿ ಇಸ್ ಅನ್ ಆಫ್ರಿಕನ್ ವುಮೆನ್, ಇವರು ಅಮೆರಿಕದಲ್ಲಿ ಸೆಟ್ಲ್ ಆಗ್ತಾರೆ. 2ನೇ ಮಹಾಯುದ್ಧದ ಸಂದರ್ಭದಲ್ಲಿ ಆರ್ಥಿಕ ಹಿನ್ನಡೆ ಆಗಿ ಅವರು ಸಿಗರೇಟ್ ವ್ಯಾಪಾರ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಆ ಸಿಗರೇಟ್ ವ್ಯಾಪಾರ ಮಾಡುವಾಗ ಬಿಸ್ನೆಸ್ ಕೊಲ್ಯಾಪ್ಸ್ ಆಗ್ತದೆ. ಅದೇ ಸಂದರ್ಭದಲ್ಲಿ ಅವ್ರಿಗೆ 20ನೇ ವಯಸ್ಸಿಗೆ ಮದುವೆ ಆಗ್ತಾರೆ. ನೆಕ್ಸ್ಟ್ 10 ವರ್ಷದಲ್ಲಿ ಅವ್ರಿಗೆ 5 ಮಕ್ಕಳು ತಾಯಿ ಆಗ್ತಾರೆ. 5ನೇ ಮಗು ಹುಟ್ಟಿದಾಗ ಅವ್ರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಡಿಟೆಕ್ಟ್ ಆಗ್ತದೆ. 1951ನೇ ಇಸ್ವಿ ಜನವರಿ 4ನೇ ತಾರೀಕು ಅವರಿಗೆ ಕ್ಯಾನ್ಸರ್, ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಡಿಟೆಕ್ಟ್ ಆಗ್ತದೆ. ಅದಾದ ನಂತರ ಅವ್ರು ಕೇವಲ 6 ತಿಂಗಳು ಬದುಕ್ತಾರೆ. ಅಕ್ಟೋಬರ್ 4ನೇ ತಾರೀಕು ತೀರೋಗ್ತಾರೆ. ಆಗ ತೀರೋದಾಗ ಮುಂಚೆ ಅವರು ಡಾಕ್ಟರ್ ಜನರಲ್ ಹಾಪ್ಕಿನ್ಸ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಅವರು ಒಬ್ರು ಡಾಕ್ಟರ್ ಏನ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ, ಅವರ ಮಾಹಿತಿನೇ ನೀಡದೇನೆ, ಅವ್ರಿಗೆ ಅವರ ಕನ್ಸಲ್ಟ್ ಇಲ್ದೇನೆ ಅವರ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ಸ್ ಗಳನ್ನ ಕಲೆಕ್ಟ್ ಮಾಡ್ಕೊಂಡಿರ್ತಾರೆ. ಅದು ಇದುವರೆಗೆ 2023 ತನಕ, 1951ರಿಂದ 2023 ತನಕ ಇನ್ನೂ ಮುಂದೆ ಇದು ಇಡೀ ಪ್ರಪಂಚದಾದ್ಯಂತ ಕ್ಯಾನ್ಸರ್ಗೆ ಎಷ್ಟು ಮಾಹಿತಿಯನ್ನ ನೀಡ್ತಾ ಇದೆ ಅಂದ್ರೆ 75,000 ರಿಸರ್ಚ್ ಸೈಟೇಷನ್ ಆಗಿದೆ ಆ ಒಂದು ಸೆಲ್ ಮೇಲೆ. ಫಸ್ಟ್ ಇಮ್ಮಾರ್ಟಲ್ ಸೆಲ್ಸ್ ಅಂತ ಕರೀತಾರೆ. ಅದು ವಿಭಜನೆ ಒಂದು ಇವತ್ತು ಕೂಡ ಜೀವಂತ ಸೆಲ್ಗಳನ್ನ ಪ್ರತಿ ಲ್ಯಾಬ್ ಅಲ್ಲಿ ಬಹುತೇಕ ಆಂಕಾಲಜಿಸ್ಟ್ ಗಳು ಇದನ್ನ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಇದೇ ಸೆಲ್ ಮೇಲೆ 3 ಜನ ನೋಬೆಲ್ ಪ್ರಶಸ್ತಿನ ಪಡೆದಿದ್ದಾರೆ. ಸ್ಪೆಷಲಿ ಇತ್ತೀಚೆಗೆ ಬಂದಂತ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ ಕೂಡ ಈ ಸೆಲ್ ಇಂದನೇ ಕಾರಣ ಆಯ್ತು. ಹಾಗಾಗಿ ಇಂಥ ಮಾಹಿತಿಗಳು ಪ್ರಪಂಚದಾದ್ಯಂತ 103ನೇ ಹುಟ್ಟುಹಬ್ಬದ ಸಂದರ್ಭದಲ್ಲಿ ಇದನ್ನ ನಾವು ರಿಸರ್ಚ್ ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ, ಮಕ್ಕಳಿಗೆ ಮತ್ತು ಟೀಚರ್ಸ್ಗೆ ಇದನ್ನ ತಿಳಿಸ್ಬೇಕು ಅನ್ನೋದು ನಮ್ಮ ಮುಖ್ಯ ಅಜೆಂಡಾ ಆಗಿತ್ತು. ಅದಾದ್ಮೇಲೆ ನಾವೇನು ಯೋಚನೆ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಯಾವಾಗ ಕೌನ್ಸಿಲಿಂಗ್ ಟ್ರಾನ್ಸ್ಫರ್ ಕೌನ್ಸಿಲಿಂಗ್ ಅಲ್ಲಿ ಲೆಕ್ಚರರ್ಸ್ ಟೀಚರ್ಸ್ ಪರ್ಸೆಂಟೇಜ್ ಆಫ್ ಅಪ್ಲಿಕೇಶನ್ಸ್ ಜಾಸ್ತಿ ಆಯ್ತು ಆನ್ ದ ಬೇಸಿಸ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್, ಸ್ಪೆಷಲಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಡಿಸೀಸ್ ಆಗಿ ಕನ್ವರ್ಟ್ ಆಗಿರೋದ್ರಿಂದ ನಾವು ಟಾರ್ಗೆಟ್ ಮಾಡಿದ್ದು ಪ್ರಿಯು ಯೂನಿವರ್ಸಿಟಿಯಲ್ಲಿ ಬೋಧನೆ ಮಾಡ್ತಕ್ಕಂಥ ಉಪನ್ಯಾಸಕರಿಗೆ ಇದು ಹೇಳ್ಸಿದ್ರೆ ಅವ್ರ ಮುಖಾಂತರ, ಬಿಕಾಸ್ ದೇ ಆರ್ ದಿ ಪಿಲ್ಲರ್ಸ್ ಆಫ್ ದ ನೇಷನ್, ದೇ ಆರ್ ದಿ ಗೇಮ್ ಚೇಂಜರ್ಸ್. ಆ ಗೇಮ್ ಚೇಂಜರ್ಸ್ ಗೆ ನಾವು ಟ್ರೈನಿಂಗ್ ಕೊಟ್ರೆ ಅವ್ರ ಮುಖಾಂತರ ಆ ಮಕ್ಕಳಿಗೆ ಎಸ್ಪೆಷಲಿ 12, 17, 18, 19 ವರ್ಷದ ಮಕ್ಕಳ ಜೊತೆ ಹ್ಯಾಂಡಲ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಅವ್ರಿಗೆ ಕೆಲವು ಕ್ಯಾನ್ಸರ್ ಸಿಂಪ್ಟಮ್ಸ್ ಗಳನ್ನ ಮಕ್ಕಳಿಗೆ ಮತ್ತು ಅವ್ರ ಮುಖಾಂತರ ಸ್ಕೂಲಿಂದ ಪೇರೆಂಟ್ಸ್ ಇಂದ ಒಂದು ಸಮಾಜಕ್ಕೆ ಅವರಿಂದ ತಲುಪಿಸಬಹುದು ಅಂತ ಹೇಳಿ ನಾವು ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ಇದನ್ನ ಬದಲಾಯಿಸ್ಕೊಂಡು, ಅದಲ್ದೇನೆ ಮತ್ತೊಬ್ಬ ಪ್ರಪಂಚದ ಅತ್ಯಂತ ಸೆಲೆಬ್ರಿಟಿ ಏಂಜಲಿನಾ ಜೋಲಿ ಅವರು 10ನೇ ವರ್ಷದ ಪುಣ್ಯ ಇದು ಕೂಡ ಇದಾಗ್ತಾ ಇದೆ, ಪುಣ್ಯ ಸ್ಮರಣೆ ಕೂಡ ಯಾಕಾಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ಅವರು ಸಾರ್ವಜನಿಕವಾಗಿ ಅವ್ರು ಆಕ್ಚುಲಿ ಒಂದು ಫಿಲಂಗೆ ಅಮೌಂಟ್ ತಗೊಳ್ಳೋದು 120 ಕೋಟಿ, 150 ಮಿಲಿಯನ್ಸ್ ರೂಪಾಯಿ ಮಾಡ್ತಾರೆ. ಅಂತ ಸೆಲೆಬ್ರಿಟಿ ಅಂದ್ರೆ ಸಮಾಜಕ್ಕೆ ನಾವು ಏನಾದ್ರೂ ಮಾಡ್ಬೇಕು ಅಂತ ಹೋದಾಗ ಅದು ಯಾವ ಮೂಲೆಯಿಂದನೂ ಅಂತೂ ಸಾಧ್ಯ ಅನ್ನೋದಕ್ಕೆ ಇವರು ಕೂಡ. ಏಂಜಲಿನಾ ಜೋಲಿಯನ್ನ ಯಾಕೆ ನಾವು ಇಲ್ಲಿ ನಿಮ್ ಮುಂದೆ ಇಡ್ತಾ ಇದೀವಿ ಅಂದ್ರೆ ಆಕೆ ಸೆಲೆಬ್ರಿಟಿ ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಹೆಚ್ಚು ಕಮ್ಮಿ ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಅಲ್ಲಿ ಹೈಯೆಸ್ಟ್ ಫಾಲೋವರ್ಸ್ ಇದ್ದಾರೆ. ಅವರು ಒಂದು ಸಿನಿಮಾಕ್ಕೆ 120 ಕೋಟಿ ತಗೊಳ್ತಾರೆ. ಆದ್ರೆ ಅವರು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ನ ಪಬ್ಲಿಕ್ ಆಗಿ ರಿವೀಲ್ ಮಾಡ್ತಾರೆ. ಈಗ ಅವರು ಶಿ ಇಸ್ ಲಿವಿಂಗ್ ವಿತ್ ಬ್ರೆಸ್ಟ್ಲೆಸ್. ಹಾಗಾಗಿ ಅವರು ಸಮಾಜಕ್ಕೆ ಏನಾದ್ರು ಒಂದು ಮೆಸೇಜ್ ಕೊಡ್ಬೇಕು. ಹಾಗೆ BRCA ಜೀನ್ ಅನ್ನ ನೀವು ಐಡೆಂಟಿಫೈ ಮಾಡ್ಕೊಂಡ್ರೆ, ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಪ್ರಪಂಚದಲ್ಲಿ ಸುಮಾರು 40% ಆಫ್ ದ ಟೋಟಲ್ ಕ್ಯಾನ್ಸರಸ್ ಸ್ಪೆಷಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬರ್ತದೆ. ಅದಕ್ಕೆ ಅವೇರ್ನೆಸ್ ಮಾಡಕ್ಕೆ ಸ್ವತಃ ಪಬ್ಲಿಕ್ ಆಗಿ 2013ನೇ ಇಸ್ವಿಯಲ್ಲಿ ಅವರು ಇವತ್ತಿಗೆ ಕರೆಕ್ಟ್ ಆಗಿ 10 ವರ್ಷಗಳ ಹಿಂದೆ, ಹಾಗಾಗಿ ಇವೆಲ್ಲ ಕೋಇನ್ಸಿಡೆನ್ಸ್ ಆಗ್ತಾ ಇದೆ, ಆ 10 ವರ್ಷಗಳ ಹಿಂದೆ ಅಂತ ಸೆಲೆಬ್ರಿಟಿ ಸಮಾಜಕ್ಕೆ ನಾನು ಏನಾದ್ರು ಒಂದು ಕೊಡುಗೆ ಕೊಡ್ಬೇಕು ಅಂತ ಹೇಳಿ ತನ್ನ ದೈಹಿಕ ಸ್ಥಿತಿಯನ್ನ, ಯಾಕಂದ್ರೆ ಸೆಲೆಬ್ರಿಟಿ ಅಂದಾಗ ಅಷ್ಟೊಂದು ಫಾಲೋವರ್ಸ್ ಏನೆಲ್ಲ ಅವರ ದೇಹ ಸಿರಿಯನ್ನ ಅನ್ಕೊಂಡು ಅವ್ರಿಗೆ ಫ್ಯಾನ್ ಆಗಿರ್ತಾರೆ. ಆದ್ರೆ ಸಮಾಜದ ದೃಷ್ಟಿಯಿಂದ ಏಂಜಲಿನಾ ಜೋಲಿ ಅಮೆರಿಕದ ಹಾಲಿವುಡ್ ನಟಿ ಏನ್ ಮಾಡ್ತಾಳೆ ಅಂದ್ರೆ 2013ರಲ್ಲಿ ತನ್ನ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಲಿವಿಂಗ್ ವಿತ್ ಆರ್ಟಿಫಿಷಿಯಲ್ ಬ್ರೆಸ್ಟ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಆಗಿರುವಂತ ರಿವೀಲ್ ಮಾಡಿದಾಗ ಇಡೀ ವರ್ಲ್ಡ್ ಅಲ್ಲಿ BRCA ಜೀನ್ 1 ಮತ್ತು 2 ಅದರ ಜೀನ್ ಗಳನ್ನ ಐಡೆಂಟಿಫೈ ಮಾಡಿಸ್ಕೊಳ್ಳಕ್ಕೆ, ಅಂದ್ರೆ ಇನ್ನೂ ಅವ್ರಿಗೆ ಡಯಾಗ್ನೈಸ್ ಆಗ ಮುಂಚೆನೆ ತಮ್ಗೆಲ್ಲ ಡೌಟ್ಸ್ ಇದೆ, ಅಥವಾ ಜೆನೆಟಿಕ್ ಬ್ಯಾಕಪ್ ಇದೆ ನಮ್ಮ ಮನೇಲಿ, ಅಥವಾ ನಮ್ಮ ಮದರ್ ಇದೆ, ಫಾದರ್ ಇದೆ, ಆ ತರದ ಏನಾರ ಹಿಸ್ಟ್ರಿ ಇದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೊಳ್ಳಕ್ಕೆ ಇವ್ರು ರಿವೀಲ್ ಮಾಡಿದ್ಮೇಲೆ ಪ್ರಪಂಚದಾದ್ಯಂತ 10-20% ಪಾಪ್ಯುಲೇಷನ್ಸ್ ಆ BRCA ಜೀನ್ ಅನ್ನ ಐಡೆಂಟಿಫೈ ಮಾಡ್ಕೊಳ್ಳಕ್ಕೆ ಹೋದ್ರು. ಅದರಿಂದ ಸುಮಾರು ಮಿಲಿಯನ್ಸ್ ಆಫ್ ಪೀಪಲ್ ಅಕ್ರಾಸ್ ದ ವರ್ಲ್ಡ್ ದೇ ಸೇವ್ ಫ್ರಮ್ ದಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. ಹಾಗಾಗಿ ಇಂಥ ಸುದಿನವನ್ನ ನಾವು ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ಆಗಿ ನಮ್ಮ ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಒಂದು ಅಂಗ ಭಾಗವಾಗಿ ಅದನ್ನ ಇದೆಲ್ಲ ಮಾಡ್ಬೇಕು ಅಂತ ನಾವು ಪ್ಲಾನ್ ಮಾಡ್ತೀವಿ. ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಾವು ಮಾನ್ಯ ಕುಲ ಸಚಿವರನ್ನ ಕುಲಪತಿಗಳನ್ನ ನಾವು ಕೇಳಿದಾಗ ಅವರು ತುಂಬು ಹೃದಯದಿಂದ ಒಪ್ಕೊಂಡ್ರು. ಈಗ ಯಾಕಂದ್ರೆ ನೀವು ಮಾಡ್ತಾ ಇರೋದು ಸಮಥಿಂಗ್ ಏನೋ ಹೇಳ್ತೀವಿ, ಲ್ಯಾಬ್ ಇಂದ ಲ್ಯಾಂಡ್ ಗೆ ಇನ್ಫಾರ್ಮೇಶನ್ ಹೋಗ್ಬೇಕು. ಯಾವ್ದೋ ಒಂದು ರಿಸರ್ಚ್ ಮಾಡ್ತಾ ಇರ್ತಕ್ಕಂಥ ಬರೀ ಲ್ಯಾಬ್ ಅಲ್ಲಿ ಉಳ್ಕೊಂಡ್ರೆ ಅದೇನು ಪ್ರಯೋಜನ ಆಗೋದಿಲ್ಲ. ಅದು ಏನಿದ್ರು ಸಮೂಹಕ್ಕೆ ಅಥವಾ ಗ್ರಾಸ್ ರೂಟ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಯಾರಿದ್ದಾರೆ ಅವ್ರಿಗೆ ರೀಚ್ ಆಗ್ಬೇಕು. ನೀವು ಮಾಡ್ತಾ ಇರೋದು ಒಳ್ಳೆ ಕೆಲಸ ಅಂತ ಹೇಳಿ ಅವ್ರಿಗೆ ನಮ್ಗೆ ಪರ್ಮಿಷನ್ ಕೊಟ್ರು. ಹಾಗಾಗಿ ಅವ್ರಿಗೆ ಈ ಸಂದರ್ಭದಲ್ಲಿ ತುಂಬ ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ತೀನಿ. ಅದಲ್ದೇನೆ ಭಾರತದ ಅಂಕಿಅಂಶಗಳ ಪ್ರಕಾರ ನಮ್ಗೆ ಗೊತ್ತಿದೆ 2022ರಲ್ಲಿ ಭಾರತದಲ್ಲಿ ಸುಮಾರು 8,86,450 ಜನ ಕ್ಯಾನ್ಸರ್ ಇಂದ ಸತ್ತಿರೋದು, ಅಕಾರ್ಡಿಂಗ್ ಟು ಈಗ ಡೆಕ್ಕನ್ ಹೆರಾಲ್ಡ್ ಮತ್ತೆ ಗೂಗಲ್ ಪ್ರಕಾರ. ಇಡೀ ಪ್ರಪಂಚದಲ್ಲಿ 2023 ಸತ್ತಿರ್ತಕ್ಕಂಥ 10 ಮಿಲಿಯನ್ ಅಂದ್ರೆ 1 ಕೋಟಿ ಜನ. ಅಂದ್ರೆ ಇನ್ಸಿಡೆನ್ಸ್ ಆಫ್ ಎಷ್ಟು ಅದೇ ಅದನ್ನ ನಂಬ್ಕೊಂಡಿರ್ತಕ್ಕಂಥ ಇದು ಏನ್ ಸಮಸ್ಯೆಯನ್ನ ಸೃಷ್ಟಿ ಮಾಡ್ತಾ ಇದೆ. ಸ್ಪೆಷಲಿ ಮಿಡ್ಲ್ ಇನ್ಕಮ್ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಕಂಟ್ರಿಗಳಲ್ಲೇ ಹೈಯೆಸ್ಟ್ ಆಗ್ತಾ ಇದೆ. ಸ್ಪೆಷಲಿ ಇಂಡಿಯಾದಲ್ಲಿ ಇವತ್ತು ಬೈ 2025 ಒಳಗಡೆ ಅವ್ರು ಹೇಳ್ತಾರೆ, ಇಂಡಿಯನ್ ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್ ಏನಿದೆ, ICMR ಏನಿದೆ, ಅವ್ರು ಏನ್ ಹೇಳ್ತಾರೆ 2000 ಈ ತರನೇ ಮುಂದುವರೆದ್ರಿ, ಈ ತರನೇ ಎನ್ವೈರನ್ಮೆಂಟ್ ಪೊಲ್ಯೂಷನ್, ಜೆನೆಟಿಕ್ ಎಫೆಕ್ಟ್ಸ್ ಗಳು ಅಥವಾ ಅವೇರ್ನೆಸ್ ಕಡಿಮೆ ಆದ್ರೆ ಭಾರತದಲ್ಲಿ 2025ರಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಪ್ರಮಾಣ ಸುಮಾರು 7 ಪಟ್ಟು ಹೆಚ್ಚಾಗ್ತದೆ ಅಂತ ಒಂದು ಪ್ರೆಡಿಕ್ಟ್ ಮಾಡಿದ್ದಾರೆ ಇವತ್ತು ನ್ಯೂಸ್ ಪ್ರಕಾರ. ಹಾಗಾಗಿ ಈ ಒಂದು ಸಣ್ಣ ಪ್ರಯತ್ನದ ಮುಖಾಂತರ ನಾವು ಏನಾದ್ರೂ ಒಂದು ಸಮಾಜಕ್ಕೆ ಅಥವಾ ಶಿಕ್ಷಕರ ಮುಖಾಂತರ, ಅವ್ರ ಮುಖಾಂತರ ನಮ್ಮ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ, ಅವ್ರ ಮುಖಾಂತರ ಪೇರೆಂಟ್ಸ್ ಗಳಿಗೆ ತಿಳಿಸೋದ್ರಿಂದ ಈ ಕಾರ್ಯಕ್ರಮ ಫಲ ಆಗ್ತದೆ ಅಂತ ಹೇಳಿ ನಂಬಿಕೆ ಇಟ್ಕೊಂಡು ನಾವು ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಆಯೋಜಿಸಿದ್ದೀವಿ. ಹಾಗಾಗಿ ಇಲ್ಲೆಲ್ಲ ನೆರೆದಿರ್ತಕ್ಕಂಥ ನಿಮ್ಮೆಲ್ಲರ ನಾನು ಕೇಳ್ಕೊಳ್ಳೋದಿಷ್ಟೇ, ನೀವು ಇಲ್ಲೇನ್ ಇನ್ಫಾರ್ಮೇಶನ್ ತಗೊಳ್ತೀರಾ ಅದನ್ನ ನಿಮ್ಮ ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ ಮತ್ತು ನಿಮ್ ಸಮೂಹಕ್ಕೆ ಸ್ಪ್ರೆಡ್ ಮಾಡಿ ಅಂತ ಈ ಮೂಲಕ ನಾನು ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ. ಅದಲ್ಲದೆ ಈ ಕಾರ್ಯಕ್ರಮ ಮುಖ್ಯವಾಗಿ ನಾನು ನಮ್ಗೆ ಒಂದ್ ಕಡೆ ಇವತ್ತು ಆಕ್ಚುಲಿ ನಮ್ದು ಇನ್ನೂ ಸ್ಟ್ರೆಂತ್ ನಾವು ಕೇಳ್ಕೊಂಡಿದ್ವಿ. ನಮ್ಮಲ್ಲಿ 250 ಕಾಲೇಜ್ಗಳಿದೆ, ಅವರಿಂದ ಅಟ್ಲೀಸ್ಟ್ ಬರ್ಬೇಕಾಗಿ ನಾವು ಕೋಇನ್ಸಿಡೆನ್ಸ್ ಏನಾಗೋಯ್ತು ಅಂದ್ರೆ ಈ ಸಾರಿ ಇವತ್ತು ಪ್ರಾಕ್ಟಿಕಲ್ದು ಓರಿಯಂಟೇಷನ್ ಟ್ರೈನಿಂಗ್ ಪ್ರೋಗ್ರಾಮ್ ಕೂಡ ಇಟ್ಕೊಂಡಿದ್ದಾರೆ. ಹಾಗಾಗಿ ಇನ್ನೂ ಸ್ವಲ್ಪ ನಾವು ನಿರೀಕ್ಷೆ ಮಾಡ್ತಾ ಇದೀವಿ. ಆದ್ರೆ ನಮ್ಮ ನಿರೀಕ್ಷೆಗೆ ರೀಚ್ ಆಗಿಲ್ಲ. ನಮ್ಮ ನಿರೀಕ್ಷೆ ಅಟ್ಲೀಸ್ಟ್ 200 ಲೆಕ್ಚರರ್ಸ್ ಬರ್ತಾರೆ ಅಂತ ನಿರೀಕ್ಷೆ ಇತ್ತು. ಬಿಕಾಸ್ ಇದು ಎಕ್ಟಿಕ್ ಶೆಡ್ಯೂಲ್ ಇದೆ, ಪ್ರಾಕ್ಟಿಕಲ್ ಎಕ್ಸಾಮ್ ಶೆಡ್ಯೂಲ್ ಇದೆ. ಆದ್ರೂ ಪರವಾಗಿಲ್ಲ, ಬಂದಿರ್ತಕ್ಕಂಥವ್ರ ಮಾಹಿತಿಯನ್ನು ತಿಳಿಸ್ತಾರೆ ಅಂತ ಈ ಕಾರ್ಯಕ್ರಮ ಹೀಗೆ ಮುಂದುವರಿತದೆ. ನಾನು ಅತ್ಯಂತ ಬೇಜಾರು ವಿಚಾರ ಅಂದ್ರೆ ಈ ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಪ್ರಾಣಿಶಾಸ್ತ್ರ ವಿಭಾಗದ SS ಮಾಲಿನಿ ಅವರು ತುಂಬಾ ಕ್ರಿಯಾಶೀಲ. ನಾನು ಬಹುಶಃ ಇಂತ HOD ಅವ್ರನ್ನ ನೋಡ್ಲೇ ಇಲ್ಲ ಅನ್ಕೊಳ್ತೀನಿ. ಯಾಕೆಂದ್ರೆ ಅಕಾಡೆಮಿಕ್ ಆಗಿ ತುಂಬಾ ಕೆಲಸ ಇರ್ತದೆ, ರಿಸರ್ಚ್ ಇರ್ತದೆ, ಪೇಪರ್ ಪ್ರೆಸೆಂಟೇಷನ್ಸ್ ಇರ್ತದೆ, ಓರಿಯಂಟೇಷನ್ ಟ್ರೈನಿಂಗ್ ಇರ್ತದೆ. ಅದಲ್ಲದೆ 2 ಕೆಲಸ ಮಾಡ್ತಾ ಇದಾರೆ ಅವರು. ಅಕಾಡೆಮಿಕ್ ಕೌನ್ಸಿಲ್ ನಲ್ಲಿ ಕೂಡ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನಾವೇನಾದ್ರು ಹೇಳಿದ್ರೆ ಇಲ್ಲ ಅದು ಸೋಷಿಯಲ್ ಕನ್ಸರ್ನ್ ಇದೆ ಅಂದ್ರೆ ಅವ್ರು ಒಪ್ಕೊಳ್ತಾರೆ. ಅದಲ್ಲದೆ ನಾನು ನಿಮ್ಮೆಲ್ಲರೂ ಕೇಳ್ಕೊಳ್ಳೋದು, ಅವ್ರೊಂದು ಮಾತು ವಿತ್ ಮಾಲಿನಿ ಅಂತ ಒಂದು ಯೂಟ್ಯೂಬ್ ಚಾನೆಲ್ ಕೂಡ ಇದೆ. ಆ ಯೂಟ್ಯೂಬ್ ಚಾನೆಲ್ ನಲ್ಲಿ ನನ್ನ ಇನ್ವೈಟ್ ಆಗಿ ಏಡ್ಸ್ ಅವೇರ್ನೆಸ್ ಮಾಡಕ್ ಹೋದಾಗ ನಾವು ಇದೆಲ್ಲ ಪ್ಲಾನ್ ಮಾಡಿದ್ದು. ಸೊ ಹಾಗೆ ನಾವು ಯಾವ್ದೋ ಒಂದು ಸೀರೆ ತಗೊಂಡಿದ್ದೋ ಅಥವಾ ಯಾವ್ದೋ ಒಂದು ಅಡಿಗೆ ಮಾಡಿದ್ದೋ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ಯಾವ್ದೋ ಒಂದು ಅಶ್ಲೀಲವಾದ ಪೋಸ್ಟ್ ಹಾಕಿದ್ರೆ ಒಂದು ದಿನಕ್ಕೆ ಎಷ್ಟೋ ಲಕ್ಷ ಮಿಲಿಯನ್ಸ್ ಸರ್ಚ್ ಮಾಡ್ಬಿಡ್ತಾರೆ. ಮೇಡಮ್ ಅವರು ಸುಮಾರು 15,000 ಜೆನೆಟಿಕ್ ಡಿಸಾರ್ಡರ್ ಗಳ ಬಗ್ಗೆ ಅವರು ಒಂದು ಹೋಪ್ ಇಟ್ಕೊಂಡಿದ್ದಾರೆ ಸಮಾಜಕ್ಕೆ. ನಾನು ಬೇಸಿಕಲಿ ಡೌನ್ ಸಿಂಡ್ರೋಮ್ ಬಗ್ಗೆ ರಿಸರ್ಚ್ ಮಾಡಿದ್ದಾರೆ. ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ, ಪ್ರತಿ ಕರ್ನಾಟಕದ ಪ್ರತಿಯೊಂದು ಒಂದು ಊರಿನಲ್ಲೂ ಕೂಡ ನೀವು ಡೌನ್ ಸಿಂಡ್ರೋಮ್ ಮಗುನ ನೋಡ್ತಾ ಇದೀವಿ. ಅದಕ್ಕೆ ಮುಖ್ಯ ಕಾರಣ ನಮ್ ಬೇಕಾದಷ್ಟು ಜೆನೆಟಿಕ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ. ಅದು ಈಸಿಲಿ ಕರೆಕ್ಟ್ ಮಾಡುವಂತದ್ದನ್ನ ನಾವು ಮಿಸ್ ಮಾಡ್ತಾ ಇದೀವಿ. ಹಾಗಾಗಿ ಅವ್ರದ್ದು ಸುಮಾರು ಮಾತು ವಿತ್ ಮಾಲಿನಿ ಅನ್ನೋ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಗ್ರಾಸ್ ರೂಟ್ ಜನರಿಗೆ ಜೆನೆಟಿಕ್ ಅನುವಂಶೀಯ ವಸ್ತುಗಳು, ಅನುವಂಶೀಯ ಕಾಯಿಲೆಗಳನ್ನ ಮತ್ತು ಜನರಿಗೆ ವೈಜ್ಞಾನಿಕ ವಿಷಯವನ್ನ ಸುಲಭವಾಗಿ ಕನ್ನಡದಲ್ಲಿ ತಿಳಿಸ್ಬೇಕು ಅಂತ ಹೇಳಿ ಮಾತು ವಿತ್ ಮಾಲಿನಿ ಕಾರ್ಯಕ್ರಮ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಆದ್ರೆ ನಮ್ಗೆ ನಿರೀಕ್ಷಿತ ಪ್ರಮಾಣದಲ್ಲಿ ಅದು ಗೇರ್ಡಪ್ ಆಗ್ತಾ ಇಲ್ಲ. ಕಾರಣ ಏನಂದ್ರೆ ನಮ್ಮ ಸಮಾಜ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾ ಎಂತ ಪ್ರಬಲವಾಗಿದೆ ಅಂದ್ರೆ ಬೇಡದೇ ಇರೋ ವಸ್ತುಗಳಿಗೆ ಪ್ರಬಲವಾಗಿ ಲೈಕ್ ಕೊಡೋದು, ವ್ಯೂ ಮಾಡ್ತಾರೆ. ನಾವು ಇವತ್ತು 1,000 ವ್ಯೂ ಲೈಕ್ ಸಬ್ಸ್ಕ್ರೈಬರ್ಸ್ ನಾವು ಮಾಡ್ಲಿಕ್ಕೆ ತುಂಬಾ ಆಗ್ತಾ ಇದೆ. ಸೊ ಇದು ಸಮಾಜದಲ್ಲಿ ಬದಲಾಗ್ಬೇಕು ಇದು. ಹಾಗಾಗಿ ಇವರ ನಿರಂತರ ಸೇವೆ ಏನೋ ಅಟ್ಲೀಸ್ಟ್ ಸಮಥಿಂಗ್ ಇಸ್ ಬೆಟರ್ ದನ್ ನಥಿಂಗ್ ಅಂತ. ಈಗ 1,000 ಇದ್ದಾರೆ. ಅಟ್ಲು ನಮ್ಮ ಗುರಿ ಏನಾಗಬೇಕು ಅಂದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ 20,000, 30,000, 40,000, 1 ಲಕ್ಷ. ಈ ಕರ್ನಾಟಕದಲ್ಲಿ 6 ಕೋಟಿ ಜನ ಇದ್ದಾರೆ. ಅಟ್ಲೀಸ್ಟ್ 1 ಕೋಟಿ ಜನ ಆದ್ರೂ ಸಬ್ಸ್ಕ್ರೈಬರ್ ಆಗಿ ವೈಜ್ಞಾನಿಕ ಮಾಹಿತಿಯನ್ನ ಅವರು ಪ್ರತಿ ಹಳ್ಳಿಯ ಸಮಸ್ತ ಜನರಿಗೂ ತಿಳಿಸ್ಬೇಕು ಅಂತ ಹೇಳಿ ಆ ಮಾತು ವಿತ್ ಮಾಲಿನಿ ಕಾರ್ಯಕ್ರಮ ಈಗಾಗಲೇ ಒಂದು QR ಕೋಡ್ ಕೊಟ್ಟಿದ್ದೀವಿ. ಅದನ್ನೆಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಆ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಅವ್ರಿಗೆಲ್ಲರೂ ಮುಂದೆ ಒಳ್ಳೇದಾಗ್ಲಿ. ಮತ್ತು ಈ ಕಾರ್ಯಕ್ರಮದ ಎಲ್ಲಾ ರೂವಾರಿಗಳು ಅವರೇ ಬಿಸಿ ಶೆಡ್ಯೂಲ್ ಅಲ್ಲಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅವರು ಕೂಡ ತುಂಬ ಧನ್ಯವಾದಗಳು. ಏನಾದ್ರು ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನ ಸಮಾಜಕ್ಕೆ ಎನಿ ಫಂಡ್ ಫ್ರಮ್ ಈಗ ನಮ್ಗೆ ಯಾವ್ದೋ ಒಂದು ಫಂಡ್ ಇಲ್ಲ, ಇದಾದ್ರೂ ನಾವು ಮಾಡ್ಬೇಕು ಅಂದಾಗ ನಮ್ಗೆ ಸಮಾಜದಲ್ಲಿ ಕೆಲವು ದಾನಿಗಳು ನಮ್ಗೆ ಹೆಲ್ಪ್ ಮಾಡ್ತಾರೆ. ಮೈಸೂರು ಯೂನಿವರ್ಸಿಟಿ ಅವರು ವೇದಿಕೆ ಕೊಟ್ಟಿರ್ಬೋದು, ಅವ್ರು ಪರ್ಮಿಷನ್ ಕೊಟ್ಟಿರ್ಬೋದು. ನಮ್ಮ PU ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅವರು ಸ್ಪೆಷಲಿ ನಮ್ಮ ಉಪನಿರ್ದೇಶಕರು ಇರ್ಬೇಕಾಗಿತ್ತು. ಅವರು ಹೇಳ್ದಂಗೆ ಆದೇಶ ಹಾಕೊಟ್ರು ನಮ್ಗೆ ರಿಪೀಟೆಡ್ ಆಗಿ ಏಡೆಡ್ ಬೇಕಾ, ಅನ್ಏಡೆಡ್ ಬೇಕಾ, ಇಲ್ಲ ಸರ್ ಎಲ್ಲ ಬರೀ ಬಯಾಲಜಿ ಬೇಕಾ, ಇಲ್ಲ ಸರ್ ಎಲ್ಲಾ ಲೆಕ್ಚರರ್ಸ್ಗೂ ಬೇಕು ಸರ್, ಬರ್ನಿಂಗ್ ಇಶ್ಯೂ ಇದೆ, ಇದ್ರ ಬಗ್ಗೆ ಎಲ್ಲರೂ ತಿಳ್ಕೊಳ್ಬೇಕು ಅಂತ ಆ ತರನೇ ಆದೇಶ ಕೊಟ್ಟರು. ತುಂಬಾ ಕ್ರಿಯೇಟಿವ್ ಡಿಡಿಪೈಸರು, ಅವ್ರಿಗೂ ಕೂಡ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಧನ್ಯವಾದಗಳು ಹೇಳ್ತೀನಿ. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಇನ್ನು ನಿಮ್ಗೆ ಊಟದ ವ್ಯವಸ್ಥೆಯನ್ನ ಮಾಡಿದಂತ ಬಾಪೂಜಿ ಸರ್ ಅವರು ಕೂಡ, ಯಾಕಂದ್ರೆ ಸಮಾಜದಲ್ಲಿ ಇಂಥ ವ್ಯಕ್ತಿಗಳಿದ್ದಾಗ ನಾವು ಇಂಥ ಕೆಲಸಗಳನ್ನ ಉಚಿತವಾಗಿ ಜನಗಳಿಗೆ ನೀಡಕ್ಕೆ ಸಹಾಯ ಆಗ್ತದೆ. ಇಂಥವ್ರು ಸಮಾಜದಲ್ಲಿ ಹೆಚ್ಚಾದಾಗ ಈ ಮಾಲಿನಿ ಮೇಡಮ್ ಅಂತವ್ರು ಸಮಾಜಮುಖಿ ಕಾರ್ಯಗಳಿಗೆ ಇನ್ನೂ ಸಪೋರ್ಟ್ ಆಗ್ತದೆ. ಹಾಗಾಗಿ ಬಾಪೂಜಿ ಸರ್ ಅವ್ರಿಗೂ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸಹಾಯ ಮಾಡಿದ್ದಾರೆ, ಅವ್ರಿಗೂ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತಾ ಈ ಕಾರ್ಯಕ್ರಮದ ಸ್ಥೂಲ ಪರಿಚಯವನ್ನ ಮಾಡ್ಕೊಳ್ಳಿಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಂತ ತಮ್ಮೆಲ್ಲರಿಗೂ ತುಂಬ ಹೃದಯದ ಧನ್ಯವಾದಗಳು ಅರ್ಪಿಸಿ ನಮ್ಮ ಮಾತು ಮುಗಿಸ್ತೇನೆ. ಧನ್ಯವಾದ.
Thank you very much, sir, for your insightful talk. I now request Professor H. Rajshekhar to address the gathering.
Once again, good morning to all of you. The respected dignitaries on the dais, the chairman of the department, Madam Professor Malini, and retired professor from the department, and one of the closest friends, Professor Ramachandra. And just now he spoke about the importance of cancer and how to treat cancer, how the cancer is going to create problems for affected person. He has given a glimpse of note on this topic. Shri H.N. Girish, ಉಪನ್ಯಾಸಕರು, ಬಾಲಕಿಯರ ಸರ್ಕಾರಿ ಪದವಿ ಪೂರ್ವ ಕಾಲೇಜು ಹುಣಸೂರು, and invited speakers, teachers from various colleges, students from various institutions, other invitees, media people, ladies and gentlemen. In fact, we'll be having one or the other function every day. But to have this kind of event, definitely it is going to give some sort of unique experience for me. Because the topic is like that. And also, this day is being celebrated as Cancer Day of the world. ನಾವು ಕ್ಯಾನ್ಸರ್ ಅಂದ ತಕ್ಷಣ ಸ್ವಲ್ಪ ವರ್ಡ್ ಅನ್ನ ಕೇಳ್ಬೇಕಂದ್ರೆ ನಮ್ಗೆ ಒಂಥರ ಮಜ್ಕುರ ಆಗ್ತದೆ. ಇದು ಎಷ್ಟರ ಮಟ್ಟಿಗೆ ಜನಗಳಲ್ಲಿ ಭಯ ಭೀತಿ ಹುಟ್ಟಿಸಿದೆ ಅಂದ್ರೆ, ಅದು ಸ್ವಲ್ಪ ಏಜ್ ಆದವರು ಪ್ರತಿದಿನ ತಮ್ಮ ಮೈ ಕೈ ಮೇಲೆ ಕೈ ಆಡಿಸ್ಕೊಂಡು ಎಲ್ಲಾರು ಒಂದು ಗುಳ್ಳೆ ಇದ್ರೆ ಸಾಕು, ಏನೋ ಒಂದು ಅವ್ರಿಗೆ ಒಂದು ನೆಗೆಟಿವ್ ಫೀಲಿಂಗ್ಸ್ ಬರ್ತದೆ, ಒಂದು ಪಿಕ್ ಆಗ್ತದೆ. ಅವರು ಇದು ಯಾಕೆ ನನಗೆ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂತ ಹೇಳಿದ್ರೆ, ನಮ್ಮ ಮನೆಯಲ್ಲಿರುವಂತ ಜನಗಳಲ್ಲೇ ಈ ತರ ಒಂದು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ನನಗೆ ಆಗಿದೆ. ಸೊ ಹಾಗಾಗಿ ಈ ಒಂದು ಕ್ಯಾನ್ಸರ್ ಅನ್ನ ಒಂದು ವರ್ಡ್ ಎಷ್ಟು ಪಾಪ್ಯುಲರ್ ಆಗಿದೆ ಅಂತ ಹೇಳಿದ್ರೆ, it is not with positive this thing, but negative impacts of this issue has led to a lot of developments. In fact, all of you know, I did not to tell you, this day is being celebrated as Cancer Day all over the world. And this day is also being called as Global Health Care Day. I think it is right. Healthcare event. For what purpose? For the awareness of cancer, which has been commemorated on 4th of every year for the past 23 years. In fact, the first celebration was done in the year 2000. After that, continuously, the event is being organized and awareness is being created, and a lot of scientific innovations are presented in front of interested people. So on this day, people from various international and local organizations will come together all over the world, unite and raises awareness about cancer. I want to be specific about our country. The incidence rate was reported between 19 to 20 lakhs cases in 2022 in our country. 19 to 20 lakh cases per year as per 2022 estimation. Look at the severity of this particular problem and how this problem is creating social sensitivity, fear among us for people. The reasons could be many, hundreds of reasons are there. But most common reasons would be our food habit, our personal other habits. So I did not to tell you everything because you know better than me about all these things. So the main theme of this 23 Cancer Day celebration is close the care gap. Under that, this theme is being used for 3 years starting from 22, 23, 24. For each year, main objectives have been identified. In 22, realizing the gap, objective was kept. In 23, uniting ourselves, our voices, taking action. For the next year, they have the objective, together we challenge, empower about the cancer program. That means very systematically, very scientifically, the problem is being taken care of, and a lot of cautions are being taken to overcome the problem. The main purpose of organizing this function, particularly this function, is to raise awareness about prevention, detection, and treatment of cancer. I'm very happy that Department of Genetics and Genomics is organizing this one-day workshop in the century-old University of Mysore. If you remember the history of cancer, it was Henrietta Lacks, 31 years old lady, when she died of an aggressive cervical cancer in 1951. And the cells are called HeLa cells, remembering her name. As a faculty from the commerce field, I remember that compared to normal cells, cancer cells proliferate uncontrollably, producing malignant tumors that invade surrounding healthy tissue. We used to the word metastasis when cancer cells are no longer amenable to surgical removal. Generally, patient survival rate is always less during this stage. Cancer has been the focus of a massive research effort for decades. There has been remarkable progress. However, much of this progress is attributed to earlier diagnosis and treatment of three major types of cancer. The first one is breast cancer, second one prostate cancer, and third one is colon cancer. Remembering that most current treatments include chemotherapy and radiation. I was told by the chairman, Professor Malini, who has also written a book on cancer biology in Kannada language. Many departments in University of Mysore, research is being carried out in the field of cancer biology from many years to develop more effective therapeutics, that is medicines. The estimates of new cancer cases in India is gradually increasing. And as I told you, as per Google, this thing, it was around 19 to 20 lakhs in 2022. Cancer deaths due to metastasis is also increasing. A similar trend is noted all over the world due to several reasons. I'm happy to note that many research laboratories of Government of India and private institutions develop many new treatments such as immunotherapy, inhibiting the activity of cancer-promoting proteins, many more advancements. Hence, it is very appropriate that we will have to look for clear communication between medical experts and teachers who will educate young minds. I am sure that the invited speakers will fill this gap because discovery of new medicines and therapies which will richly contribute to cancer biology and its cure. I hope today's workshop on cancer and its prevention is very appropriately organized in the university to discuss the most recent innovations in cancer prevention and management. I wholeheartedly congratulate the chairperson, faculty, and all other staff members of the Genetics and Genomics Department for initiating this one-day workshop commemorating World Cancer Day. So I definitely presume that day-long deliberations on this particular topic will bring out the new thoughts and makes people to be thought-provoking on this particular issue. And I hope that once this workshop is completed, definitely will carry memorable ideas in your mindset. You will have some more new ideas to be applied in your future, maybe teaching profession or in practicing profession. Professor Malini has taken key interest. In fact, she used to be very active in all types of activities relating to her department. Strong foundation has been laid down by Professor Ramchandra. She also did her PhD under Professor Ramchandra, and she has been worth enough to lead the department. Because of that, she has been doing a wonderful job in the department. So this kind of efforts would continue forever. Then only the department may grow, new thoughts would emerge, more and more students would be attracted towards the course. One fine day, the course would be internationalized and international students would be attracted towards the department. With these few words, I thank the department for inviting me and to share some ideas about this topic in front of you. And also I thank all the participants for your patient listening about my presentation. Thank you.
Thank you very much, sir, for your presence and your words of wisdom. I now request the dignitaries to felicitate Professor H. Rajashekar. I now request Professor N.V. Ramachandra to speak a few words.
Hello, namaskara. Good morning to you all. I hope you've seen me how I came in, but I will not take much time. Respected Honorable Vice Chancellor of Mysore University, a good friend, Professor Rajashekar, and Dr. Malini, the Chairman of the Department of Genetics and Genomics, my friend Girish, who is doing wonderful work. Friends, today is the Cancer Day, and remembering the people who contributed their own cells and their own research for the treatment of the cancer for the whole globally. Anjali Julian, he said, she found her mother and her aunt had a cancer, and she mastectomized her breast and sequenced the whole genome of her. She found that the gene, what was defective in her and in the mother and the aunt were the same, and she is under treatment of monoclonal antibody. Regarding the HeLa cells, they said millions of people are getting benefited because the cancer cells are being used for cell culture and different kind of experiments are being used. And finally, somebody has sequenced the HeLa cell. Now it brought to the whole the scientific community who permitted my cell or my aunt cell to sequence. That was her family was asking the question, her family members were asking the questions now. So now I'm bringing another issue, ethics. When you do diagnosis, when you do treatment in the medical fraternity, we need to have very good ethics. If you do not have ethics, then it's very, very problems. Unless you take we cannot treat the patients who are already suffering as a slave, or he should listen whatever you say. We have to treat them as that, we have to respect them, and you have to take their consent. That is the whole issue now is coming up, the consent, the patient consent, the family consents. We have to keep this into mind. And the one more point I want to tell, the 2012, the UK government, the Genomics England, the government has started the company. 1 lakh patient sequence has been done 2012 to 2018, whole genome sequence, and about 10 cancer. This is the 10 more proliferant cancers. The treatment already they have identified now, which is the culprit gene expression level or different level. They are already in the treatment. 2018 onwards, they have treated. They will going to be a world leader, UK world leader, because the 1 lakh patient sequence is available and the treatment is also available. The last I wanted to tell, genetic diseases are treatable, preventable, manageable, but to cure, we need some more research, some more our saturated level of the understanding. Thank for giving the opportunity to talk few words about me. Even my own students, one of the foreign students I did a myeloma genome exome sequencing. We could able to identify the driver genes and the passenger genes, and they are responsible for the myeloma cancer and so on. So there are billions of people are doing service, research, and treatment, and we have to thank all of them, and also the patients and the family for giving their samples for any kind of analysis. We have to respect them, we have to respect each other. The cancer, they have to remember all of them. Thank you for giving me this opportunity. All the best for the whole day delegation. Thank you.
Thank you very much, sir. Now I call upon Janavi to deliver the vote of thanks. ಎಲ್ಲರಿಗೂ ಶುಭ ಮುಂಜಾನೆ. ಎಲ್ಲಾ ವಿದ್ಯಾರ್ಥಿಗಳು ಮತ್ತು ಸಿಬ್ಬಂದಿಯ ಪರವಾಗಿ ನಾನು ಧನ್ಯವಾದಗಳನ್ನು ವ್ಯಕ್ತಪಡಿಸಲು ಇಲ್ಲಿ ನಿಂತಿರುವುದಕ್ಕೆ ನನಗೆ ಸಂತೋಷವಾಗಿದೆ. ನಮ್ಮ ಆಹ್ವಾನವನ್ನು ಸ್ವೀಕರಿಸಿದ್ದಕ್ಕಾಗಿ ಮತ್ತು ಇಂದು ಭಾಗವಹಿಸಿದ್ದಕ್ಕಾಗಿ ಅಧ್ಯಕ್ಷರು ಪ್ರೊಫೆಸರ್ ಎಚ್ ರಾಜಶೇಖರ್, ಮಾನ್ಯ ಕುಲಪತಿಗಳು, ಮೈಸೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ಇವರಿಗೆ ವಿಶೇಷ ಧನ್ಯವಾದಗಳು. ಮುಖ್ಯ ಅತಿಥಿಗಳು ಶ್ರೀ ನಾಗಮಲ್ಲೇಶ್, ಉಪನಿರ್ದೇಶಕರು, ಪದವಿ ಪೂರ್ವ ಶಿಕ್ಷಣ ಇಲಾಖೆ ಮೈಸೂರು. ವಿಶೇಷ ಆಹ್ವಾನಿತರು ಡಾಕ್ಟರ್ ಪಿ.ಕೆ. ಕಿರಣ್, ಕ್ಯಾನ್ಸರ್ ರೋಗ ತಜ್ಞರು, JSS ವೈದ್ಯಕೀಯ ಮಹಾವಿಶ್ವವಿದ್ಯಾನಿಲಯ. ಡಾಕ್ಟರ್ ಶಿವಾನಂದ ಮನೋಹರ್ ಜೆ, ಮನೋರೋಗ ತಜ್ಞರು, JSS ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯ. ಡಾಕ್ಟರ್ ಶ್ಯಾಮಸುಂದರ್ NM, ನಿವೃತ್ತ ಪ್ರಾಧ್ಯಾಪಕರು. ಶ್ರೀ HM ಗಿರೀಶ್, ಉಪನ್ಯಾಸಕರು. ಪ್ರೊಫೆಸರ್ NB ರಾಮಚಂದ್ರ, ಜೆನೆಟಿಕ್ಸ್ ಮತ್ತು ಜೀನೋಮಿಕ್ಸ್ ವಿಭಾಗ ಇವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಮತ್ತು ಬಾಪೂಜಿರವರು ಹಾಗೂ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿದವರು, ವಿದ್ಯಾರ್ಥಿಗಳು, ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಅಧಿಕಾರಿಗಳು, ರಾಣಿ ಬಹದ್ದೂರ್ ಸಭಾಂಗಣದವರು ಮತ್ತು ಮಾಧ್ಯಮ ಮಿತ್ರರಿಗೆ ನನ್ನ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳು. Thank you, Janavi. Our first talk of the day is Close the Care Gap, Cancer Awareness by Dr. P.K. Kiran. I call upon Rakshita to give a brief introduction of Dr. P.K. Kiran. Dr. Kiran PK. Sir has completed MBBS in Jesus Medical College and he is a gold medalist in general medicine and studied medical oncology in BE. He worked as a senior resident general medicine in Jesus Medical College, Mysore. EMD resident medical oncology in HCG hospitals in Bangalore. He also worked as assistant professor in Department of Medical Oncology in Jesus Medical College and Hospital. Sir has published 16 research articles. And now over to you, sir.
Good morning. Once again, I feel proud, happy to be a part of this program on this auspicious day of World Cancer Day and Awareness Day. So for today, it will be an educational program, not like a teaching, because most of them are teachers here, can't teach them, and I have a connection with teachers because my father himself is a teacher. He was a lecturer of sociology. So for today, we'll learn something about the cancer awareness, how it spreads and what are the treatment options. So overall, Kannada ಮತ್ತು English ಎರಡು ಮಾಡ್ಕೊಂಡು ಮಾತಾಡೋಣ so that everyone will come to know. ಮೊದಲನೇದಾಗಿ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಅಂದ್ರೆ ಎಲ್ಲರೂ ಹೇಳಿದಾಗೆ ಒಂದು ಭಯ ಹುಟ್ಟುತ್ತೆ. ಕ್ಯಾನ್ಸರ್ ಅಂತ ಅಂದ್ರೆ ಏನೋ ಒಂದು ಕಾಯಿಲೆ. ಅಫ್ಕೋರ್ಸ್ ಹೌದು, ಕ್ಯಾನ್ಸರ್ ಒಂದು ಕಾಯಿಲೆ. ಏನಕ್ಕಂದ್ರೆ ಎಲ್ಲಾ ಕ್ಯಾನ್ಸರ್ಗಳಿಗೂ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂತ ಇಲ್ಲ, ಎಲ್ಲದನ್ನು ಕ್ಯೂರ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ. ಈಗ ಬೇರೆ ಕಾಯಿಲೆಗಳಿಗೆ ಸ್ವಲ್ಪ ಕ್ಯೂರ್ ಇಲ್ಲ ಅಂತ ಅಂದ್ರೆ ಒಂದು ಲೈಫ್ ಎಕ್ಸ್ಪೆಕ್ಟೆನ್ಸಿ ಅಂತ ಏನಿರುತ್ತೆ ಅದು ನಾರ್ಮಲ್ ಇರುತ್ತೆ, ಪ್ರಾಣಕ್ಕೆ ತೊಂದರೆ ಆಗಲ್ಲ. ಬಟ್ ಕ್ಯಾನ್ಸರ್ಲಿ ಸ್ವಲ್ಪ ಪ್ರಾಣಕ್ಕೆ ತೊಂದರೆ ಆಗುವಂತ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಅಡ್ವಾನ್ಸ್ ಸ್ಟೇಜಸ್ ಅಲ್ಲಿ, ಅಂದ್ರೆ 4th ಸ್ಟೇಜ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಅಲ್ಲಿ. ಕ್ಯಾನ್ಸರ್ ಅಂತ ಬಂದಾಗ ಮೊದಲನೇದು ಕನ್ನಡದಲ್ಲಿ ಗಂಟು ರೋಗ ಅಂತಾನೆ ಹೇಳ್ತೀವಿ, ಇಲ್ಲ ಅರ್ಬುದ ಕಾಯಿಲೆ ಅಂತಾನೆ ಹೇಳ್ತೀವಿ. ಇಂಗ್ಲಿಷ್ ನಲ್ಲಿ ಅದನ್ನ ಕ್ಯಾನ್ಸರ್ ಅಂತೀವಿ, ಮೆಡಿಕಲ್ ಟರ್ಮ್ ಅಲ್ಲಿ ಆಂಕಾಲಜಿ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಹೇಳ್ತೀವಿ. ಸೊ ನಾನು ಡಾಕ್ಟರ್ ಕಿರಣ್, ಮೆಡಿಕಲ್ ಆಂಕಾಲಜಿಸ್ಟ್. ಅಂದ್ರೆ ನಾನು ಟ್ರೀಟ್ ಮಾಡೋದು ಕೀಮೋಥೆರಪಿ, ಹಾರ್ಮೋನಲ್ ಇಲ್ಲ ಟಾರ್ಗೆಟೆಡ್ ಥೆರಪಿ ಅಂತ ಟ್ರೀಟ್ ಮಾಡ್ತೀವಿ. ನಮ್ಮ ಆಂಕಾಲಜಿಗೆ ಅಂತ ಬಂದಾಗ 3 ಬ್ರಾಂಚ್ಗಳ ತರ ಬರ್ತದೆ. ಒಂದು ಸರ್ಜಿಕಲ್ ಆಂಕಾಲಜಿ, ಮೆಡಿಕಲ್ ಆಂಕಾಲಜಿ ಮತ್ತೆ ರೇಡಿಯೇಷನ್ ಆಂಕಾಲಜಿ. ಮೆಡಿಕಲ್ ಆಂಕಾಲಜಿ ಅಂತ ಅಂದ್ರೆ ಕೀಮೋಥೆರಪಿ ಎಲ್ಲ ಮಾಡುವಂತ ಬ್ರಾಂಚ್. ಸರ್ಜಿಕಲ್ ಆಂಕಾಲಜಿ ಅಂದ್ರೆ ಆಪರೇಷನ್ ಮಾಡ್ತಾರೆ. ರೇಡಿಯೇಷನ್ ಆಂಕಾಲಜಿ ಅಂದ್ರೆ ವಿಕಿರಣ ಚಿಕಿತ್ಸೆ ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದ್ರೆ ರೇಡಿಯೋಥೆರಪಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಗಳನ್ನ ಕೊಟ್ಟು ಕ್ಯಾನ್ಸರ್ ಗಳನ್ನ ಕರಗಿಸೋದು ಇಲ್ಲ ಅದನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋದು. ಸೊ ಇವತ್ತಿನ ದಿನ ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ. ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಅದಕ್ಕೆ ಸುಮಾರು ಸಿಂಬಲ್ಗಳಿದಾವೆ. ಸೊ ಅಲ್ಲಿ ಸೊ ನೀವೆಲ್ಲ ನೋಡ್ತಿರೋ ಹಾಗೆ ಇದು ಪರ್ಪಲ್ ಕಲರ್ ರಿಬ್ಬನ್. ಎಲ್ಲ ಕ್ಯಾನ್ಸರ್ಗಳಿಗೆ ಇಂಡಿಕೇಶನ್ ಅದು ಪರ್ಪಲ್ ಕಲರ್ ರಿಬ್ಬನ್. ಬ್ರೆಸ್ಟ್ಗೆ ನಾವು ಮೋಸ್ಟ್ ಕಾಮನ್ ಆಗಿ ನಾವು ನೋಡ್ತೀವಿ ಪಿಂಕ್ ಕಲರ್ ರಿಬ್ಬನ್. ಸೊ ಎಲ್ಲಾ ಕ್ಯಾನ್ಸರ್ಗೂ ಒಂದೊಂದು ಕಲರ್ ರಿಬ್ಬನ್ಗಳನ್ನ ಈ ತರ ಇಂಡಿಕೇಟ್ ಮಾಡಿ ಅವತ್ತಿಗೆ ಒಂದೊಂದು ಮಂತಲ್ಲಿ ಒಂದೊಂದು ಅವೇರ್ನೆಸ್ ಅಂತ ಕ್ರಿಯೇಟ್ ಮಾಡ್ತೀವಿ ನಾವು. ಈಗ ಫೆಬ್ರವರಿಗೆ ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ, ಅದೇ ತರನೇ ಒಂದು ನವೆಂಬರ್ಲಿ ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಬರುತ್ತೆ, ಡಿಸೆಂಬರ್ಲಿ ಕೊಲಾನ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಬರುತ್ತೆ, ಮತ್ತೆ ಅಕ್ಟೋಬರ್ ಇಲ್ಲ ಸೆಪ್ಟೆಂಬರ್ಲಿ ಒಂದು ಸಾರ್ಕೋಮಾ ಕೇಸಸ್ ಅಂತ ಬರ್ತದೆ. ಹಾಗೆ ಒಂದೊಂದು ಕ್ಯಾನ್ಸರ್ ದಿನ ಒಂದೊಂದು ಅವೇರ್ನೆಸ್ ಅಂತ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಒಂದೊಂದು ಕಲರ್ ಇಂಡಿಕೇಶನ್ ಅಂತ ಮಾಡಿದ್ವಿ. ಹಾಗಾಗಿ ಇವತ್ತು ಪರ್ಪಲ್ ರಿಬ್ಬನ್ ಅದು ಇಂಡಿಕೇಟ್ ಮಾಡುತ್ತೆ ಕ್ಯಾನ್ಸರ್ಗಳು. ನೆಕ್ಸ್ಟ್ ಇವತ್ತಿನ ದಿನ ಏನಕ್ಕೆ ಇದು ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಅಂತ ಹೇಳಿದ್ರೆ, ಕ್ಯಾನ್ಸರ್ ರೋಗಗಳು ಪ್ರಪಂಚದಲ್ಲಿ ದಿನದಿಂದ ದಿನಕ್ಕೆ ಜಾಸ್ತಿ ಆಗ್ತದೆ. ಅದು ಏನಕ್ಕೆ ಜಾಸ್ತಿ ಆಗ್ತದೆ ಕಾರಣ ಸುಮಾರು ಇದಾವೆ. ಲೈಫ್ ಸ್ಟೈಲ್ಸ್ ಅದೆಲ್ಲ ಡೀಟೇಲ್ ಆಗಿ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಅಲ್ಲಿ ನೋಡೋಣ. ಪ್ಲಸ್ WHO ಮತ್ತೆ UICC ಅಂತ ಹೇಳ್ತಾರೆ, ಅಂದ್ರೆ ಯೂನಿಯನ್ ಆಫ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ ಅಂತ. WHO ಮತ್ತೆ UICC ಇಬ್ರು ಸೇರ್ಕೊಂಡು ಫೆಬ್ರವರಿ 4 ಒಂದು ದಿನ ಅಂತ ಮಾಡಿ ಎಲ್ಲಾ ಸೋಷಿಯಲ್ NGOs ಗಳು ಎಲ್ಲಾ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಗಳೆಲ್ಲ ಸೇರ್ಕೊಂಡು ಒಂದು ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಬೇಕು. ಅದ್ರ ಅವೇರ್ನೆಸ್ ಅಂದ್ರೆ ಯಾವ ತರ ಇರ್ಬೇಕಂದ್ರೆ, ಪಬ್ಲಿಕ್ ಗೆ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಈ ತರ ಚಿಕಿತ್ಸೆಗಳಿದಾವೆ, ಈ ತರ ರೋಗ ಇದೆ, ಈ ತರ ಯಾರು ಭಯ ಪಡಬೇಕಾಗಿಲ್ಲ, ಅರ್ಲಿ ಸ್ಟೇಜಸ್ ಅಲ್ಲಿ ಗೊತ್ತಾಗ ಈ ತರ ಆಗುತ್ತೆ ಅಂತ ಅನ್ಬಿಟ್ಟು ಅವೇರ್ನೆಸ್ ನ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಬೇಕಂತ ಒಂದು ವಾಕಥಾನ್ ಮಾಡೋದು, ಮ್ಯಾರಥಾನ್ ಮಾಡೋದು, ಒಂದಷ್ಟು ಆಕ್ಟಿವಿಟೀಸ್ ಗಳನ್ನ ಹಮ್ಮಿಕೊತಾರೆ. ಅದು February 4th. ಅದಕ್ಕೋಸ್ಕರ ಅದನ್ನ ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಅಂತ. ಪ್ರತಿ ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇಗೆ ಪ್ರತಿ ವರ್ಷ ಮಾಡ್ಬೇಕಾದ್ರೆ ಒಂದು ಥೀಮ್ ಅಂತ ತಗೋದು. ಆ ಥೀಮ್ ಏನಂತ ಅಂದ್ರೆ ಅದು ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ನ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಲಿಕ್ಕೆ. ಈಗ ಲಾಸ್ಟ್ ಒಂದ್ ಥೀಮ್ ತಗೊಂಡ್ರೆ ಅದು ಪ್ರತಿ 3 ವರ್ಷ ಆ ಥೀಮ್ ನೇ ಒಂದು ಇಟ್ಕೊಂಡು ಒಂದು ಗುರಿಯಾಗಿ ಇಟ್ಕೊಂಡು ಅದ್ರ ಮೇಲೆನೆ ಜಾಸ್ತಿ ಪ್ರಚಾರ ಮಾಡುವಂತ. ಲಾಸ್ಟ್ 2022 ಇಲ್ಲ, 22, 23 and 24 3 ವರ್ಷದ ಕ್ಯಾನ್ಸರ್ ಥೀಮ್ ಅಂತ ಅಂದ್ರೆ ಕ್ಲೋಸ್ ದ ಕೇರ್ ಗ್ಯಾಪ್. ಅಂದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ ಅಲ್ಲಿ ಇರೋ ಗ್ಯಾಪ್ ನ ಅದನ್ನ ಮುಚ್ಚಾಕೋದು ಅಂತ ಲಿಟ್ರಲ್ ಮೀನಿಂಗ್. ಕ್ಲೋಸ್ ದ ಕೇರ್ ಗ್ಯಾಪ್ ಅಂತ ಹೇಳಿದ್ರೆ ಒಂದು ಕ್ಯಾನ್ಸರ್ ಚಿಕಿತ್ಸೆಗಳ ತಾರತಮ್ಯಗಳು. ಅಂದ್ರೆ ಈಗ ಹಳ್ಳಿಲಿ ಯಾರಿಗಾರೊಬ್ರು ಕ್ಯಾನ್ಸರ್ ಬಂದಿರುತ್ತೆ, ಸಿಟಿನಲ್ಲಿ ಯಾರಿಗಾರೊಬ್ರು ಕ್ಯಾನ್ಸರ್ ಬಂದಿರುತ್ತೆ. ಬಟ್ ಹಳ್ಳಿ ಜನಗಳಿಗೆ ಸಡನ್ ಆಗಿ ಅವರು ಸಿಟಿಗೆ ಬಂದು ಅಷ್ಟೊಂದು ದೊಡ್ಡ ಸಿಟಿಗಳೆಲ್ಲ ಹೋಗಿ ಅವ್ರು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳಕ್ ಆಗಲ್ಲ. ಒಂದು ಟ್ರಾನ್ಸ್ಪೋರ್ಟೇಷನ್ ಇರ್ಬೋದು, ಇಲ್ಲ ಫೈನಾನ್ಷಿಯಲ್ ಇರ್ಬೋದು, ಇಲ್ಲ ಲ್ಯಾಕ್ ಆಫ್ ಎಜುಕೇಶನ್ ಇರ್ಬೋದು. ಅದೇ ಸಿಟಿ ಜನಗಳಿಗೆ ಸ್ವಲ್ಪ ಬೇಗ ಅವ್ರಿಗೆ ಆಕ್ಸೆಸ್ ಸಿಗುತ್ತೆ ಹೆಲ್ತ್ ಫೆಸಿಲಿಟೀಸ್ ಗಳಿಗೆ, ಬೇಗ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ ಗಳು ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಆ ತರ ಒಂದು ಎಜುಕೇಶನ್ ಇರುತ್ತೆ. ಸೊ ಈ ತಾರತಮ್ಯ ಏನಿದೆ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಲ್ಲಿ, ಮತ್ತೆ ದೊಡ್ಡವರ ಆಗಿರ್ಬೋದು, ಮಕ್ಕಳಾಗಿರ್ಬೋದು, ಇಲ್ಲ ಜೆಂಡರ್ ಇನಿಕ್ವಾಲಿಟಿ ಏನ್ ಬರ್ತದೆ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಲ್ಲಿ. ಈ ಇನಿಕ್ವಾಲಿಟೀಸ್ ಇನ್ ದ ಕೇರ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್, ಟು ರಿಮೂವ್ ದಿಸ್ ಇನಿಕ್ವಾಲಿಟಿ, ದಟ್ ಈಸ್ ದ ಥೀಮ್ ಆಫ್ ಕ್ಲೋಸ್ ದ ಕೇರ್ ಗ್ಯಾಪ್. ಕ್ಯಾನ್ಸರ್ ಚಿಕಿತ್ಸೆಯಲ್ಲಿ ಇರೋ ತಾರತಮ್ಯನ ಹೋಗಲಾಡಿಸದೆ ಕ್ಲೋಸ್ ದ ಕೇರ್ ಗ್ಯಾಪ್. ಮೊದಲನೇ ವರ್ಷ ಗ್ರೌಂಡ್ ರಿಯಾಲಿಟಿನ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದು, 2ನೇ ವರ್ಷ ಅದ್ರನ್ನ ಏನೇನು ಇವ್ರಿಗೂ ಗ್ರೌಂಡ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಯಾರು ವರ್ಕ್ ಮಾಡ್ತಾರೆ ಅವ್ರನ್ನೆಲ್ಲ ಉಪಯೋಗಿಸ್ಕೊಂಡು ಒಂದು ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋದು. 3ನೇ ವರ್ಷ ಏನ್ ಮಾಡೋದು, ಇದೆಲ್ಲ ಏನು ನಾವು ಇನ್ಫಾರ್ಮೇಶನ್ ತಗೊಂಡಿರ್ತೀವಿ ಅದನ್ನ ಹೈಯರ್ ಅಥಾರಿಟೀಸ್ಗೆ ಅದನ್ನ ಅಪ್ಲೈ ಮಾಡಿ ಎಷ್ಟು ಕೈಲಾದಷ್ಟು ಮಟ್ಟಿಗೆ ಆ ಗ್ಯಾಪ್ ನ ರಿಮೂವ್ ಮಾಡದೆ ಕ್ಲೋಸ್ ದ ಕೇರ್ ಗ್ಯಾಪ್. ಸೊ ಇದು ಈ ಥೀಮ್ ನ 2ನೇ ವರ್ಷ. ಇದಕ್ಕಿಂತ ಮುಂಚೆ ಇದ್ದು ಐ ವಿಲ್ ಅಂತ, ಅದು ಬೇಸಿಕಲಿ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ ಗಳಿಗೆ ಮಾಡ್ದಿರೋಂಥ ಥೀಮ್. ಅದೇನಂದ್ರೆ ನಾನು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋತೀನಿ, ನಾನು ಹೆದರಲ್ಲ ಅಂತ ಒಂದು ಥೀಮ್ ಇಟ್ಕೊಂಡು 3 ವರ್ಷ ಮಾಡಿದ್ರು. ಇವಾಗ ಈ 3 ವರ್ಷ 22, 23, 24ನೇ ಇಸ್ವಿ, ಇದು 2ನೇ ವರ್ಷ 23ನೇ ಇಸ್ವಿ, ಕ್ಲೋಸ್ ದ ಕೇರ್ ಗ್ಯಾಪ್. ಸೊ ಮುಂದಿನ ವರ್ಷನೂ ಇದೇ ತರ ಥೀಮ್ ಇರುತ್ತೆ, ಬಟ್ ಆಬ್ಜೆಕ್ಟಿವ್ಸ್ ಡಿಫ್ರೆಂಟ್, ಆಬ್ಜೆಕ್ಟಿವ್ಸ್ ಬೇರೆ ಬೇರೆ. ಈಗ ಕ್ಯಾನ್ಸರ್ ಏನಕ್ಕೆ ಇಷ್ಟೊಂದು ಚರ್ಚೆ ಆಗ್ತಿರೋ ವಿಷಯ, ಕ್ಯಾನ್ಸರ್ ಏನಕ್ಕೆ, ಬೇರೆ ಕಾಯಿಲೆಗಳ ಬಗ್ಗೆ ಏನಕ್ಕೆ ಇಷ್ಟೊಂದು ಚರ್ಚೆ ಆಗ್ತಾ ಇಲ್ಲ ಎಲ್ಲಾ ಕಡೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಯಾಕಂದ್ರೆ ನಾವು ಇಲ್ಲಿ ನೋಡ್ತಿರೋ ಪ್ರಕಾರ ಒಂದು ಹೈಯೆಸ್ಟ್ ಕಾಸ್ ಆಫ್ ಡೆತ್ ನಮ್ಮ ಭಾರತದಲ್ಲಿ, ಲೀಡಿಂಗ್ ಕಾಸ್ ಆಫ್ ಡೆತ್ ಅಂತ ಅಂದ್ರೆ ಕಾರ್ಡಿಯೋವಾಸ್ಕ್ಯುಲರ್ ಡಿಸೀಸಸ್, ಅಂದ್ರೆ ಹಾರ್ಟ್ಗೆ ಸಂಬಂಧಪಟ್ಟಿದ್ದ ಕಾಯಿಲೆ. ಹಾರ್ಟ್ಗೆ ಸಂಬಂಧಪಟ್ಟಿದ್ದ ಕಾಯಿಲೆ ಅಂತ ಅಂದ್ರೆ ಅದು ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ಸ್ ಇರ್ಬೋದು, ಇಲ್ಲ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಇರ್ಬೋದು. ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ಸ್ ಅಂತ ಅಂದ್ರೆ ಸಡನ್ ಆಗಿ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗೋದು, ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಂತ ಅಂದ್ರೆ ಹೃದಯ ಸ್ತಂಭನ ಒಂದೇ ಸಲ ಆಗುವಂಥದ್ದು. ಅದು ಫಸ್ಟ್ ಕಾಸ್ ಆಫ್ ಡೆತ್. ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಮತ್ತೆ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ಗಳು ಹಾರ್ಟ್ಗೆ ಸಂಬಂಧಪಟ್ಟಿದ್ದ ಕಾಯಿಲೆಗಳು. ಎರಡನೇ ನೀವು ನೋಡ್ತಾರ ಪ್ರಕಾರ 2ನೇ ರೀಸನ್ನೇ ಕ್ಯಾನ್ಸರ್. ಸೊ ಹಾಗಾಗಿ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಅತಿ ಮುಖ್ಯವಾಗಿ ಒಂದು ಜಾಗೃತಿ ಇರ್ಬೇಕಂತ ಅಂತ ಅದಕ್ಕೋಸ್ಕರ ಇಷ್ಟೊಂದೆಲ್ಲ ಎಜುಕೇಶನ್ ಪ್ರೋಗ್ರಾಮ್ಗಳು, ಇಷ್ಟೊಂದೆಲ್ಲ ಜಾಥಾಗಳೆಲ್ಲ ಆಗ್ತದೆ. ಮತ್ತೆ 3ನೇದು ಇನ್ನ ಬೇರೆ ಬೇರೆ ಎಲ್ಲ ಬರ್ತದೆ, ರೆಸ್ಪಿರೇಟರಿ ಡಿಸಾರ್ಡರ್ಸ್, ಇನ್ಫೆಕ್ಷನ್ಸ್, ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಡಿಸಾರ್ಡರ್ಸ್, ಮತ್ತೆ ಸೈಕ್ಯಾಟ್ರಿ ಡಿಸಾರ್ಡರ್ಸ್, ಸುಯಿಸೈಡ್ ಆಗುವಂಥದ್ದು, ಬೇರೆ ಕೊಲೆಗಳಾಗುವಂಥದ್ದು, ವಾರ್ ಟೆರರಿಸಮ್, ಅದೆಲ್ಲ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆಲ್ಲ ಇರುತ್ತೆ. ಬಟ್ ಮೇಜರ್ ರೀಸನ್, ಸೆಕೆಂಡ್ ಮೋಸ್ಟ್ ಕಾಮನ್ ಕಾಸ್ ಆಫ್ ಡೆತ್ ಇನ್ ಇಂಡಿಯಾ ಆಸ್ ಪರ್ ಟುಡೇ ಇಸ್ ಕ್ಯಾನ್ಸರ್. So that is the main reason why we need to have a proper education, proper awareness about cancer. So cancer ಅಂದ್ರೆ ಏನು? What is cancer? Cancer ಈಗ ಎಲ್ರಿಗೂ ಗೊತ್ತು, ಒಂದು ಏನಾದ್ರು ಒಂದು ಗಂಟು ಇದೆ ಅಂತ ಅಂದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಇರ್ಬೋದು ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಎಲ್ರಿಗೂ ಗೊತ್ತಾಗುತ್ತೆ. ಕ್ಯಾನ್ಸರ್ ಹೆಂಗ್ ಗೊತ್ತಾಯ್ತು ಫಸ್ಟ್ ಅಂತ ಅಂದ್ರೆ, ನಾವು ಹಿಸ್ಟ್ರಿಗೆ ಹೋಗಿ ನೋಡೋದಾದ್ರೆ, ಗ್ರೀಕ್ ದೇಶದಲ್ಲಿ ಡೆಡ್ ಬಾಡೀಸ್ ಗಳನ್ನೆಲ್ಲ ಅವರು ಉಣ್ತಿದ್ರು, ಹಾಗೇನೆ ಸುಡ್ತಿರ್ಲಿಲ್ಲ. ಮುಂದಾಗ ಏನಾಗುತ್ತೆ, ಅಲ್ಲಿ ಹ್ಯೂಮಿಡಿಟಿ ಪ್ರಕಾರ ಏನಾಗುತ್ತೆ, ಅದು ಕೊಳಿತಿರ್ಲಿಲ್ಲ, ಸ್ವಲ್ಪ ಹಂಗೆ ಒಂಥರ ಒಣಗ್ತಾ ಇದೆ. ಅದನ್ನ ಮಮ್ಮಿಫೈಡ್ ಬಾಡಿ ಅಂತ ಹೇಳ್ತೀವಿ, ಮಮ್ಮಿಫಿಕೇಶನ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಸ್ಕಿನ್ ಎಲ್ಲ ಹಾಗೆ ಡ್ರೈ ಆಗುತ್ತೆ, ಮತ್ತೆ ಆರ್ಗನ್ಸ್ ಎಲ್ಲ ಒಳಗಡೆ ಎಲ್ಲ ಡ್ರೈ ಆಗುತ್ತೆ, ಕಂಪ್ಲೀಟ್ ಡಿಹೈಡ್ರೇಷನ್ ಆಗುತ್ತೆ ಮಮ್ಮಿಫೈಡ್ ಬಾಡಿ. ಆ ಮಮ್ಮಿಫೈಡ್ ಬಾಡಿನಲ್ಲಿ ಏನಾಗ್ತಿತ್ತು, ಒಬ್ಬೊಬ್ಬರು ಬಾಡಿನಲ್ಲಿ ಬೋನ್ಸ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ದಪ್ಪ ಗಂಟುಗಳು, ಸ್ವೆಲ್ಲಿಂಗ್ ಗಳು ಕಾಣಿಸ್ತು. ಅದನ್ನ ನೋಡಿದಾಗ ಮಮ್ಮಿಫೈಡ್ ಬಾಡೀಸ್ ನಲ್ಲಿ ಸ್ವಲ್ಪ ಊತ ತರ ಬರ್ತಾ ಇದೆ. ಅದನ್ನ ಅದೇನೋ ಇದೆ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಅದನ್ನ ತಗೊಂಡು ಸ್ವಲ್ಪ ಪರೀಕ್ಷೆಗಳೆಲ್ಲ ಮಾಡಿದಾಗ ಅದು ಬೋನ್ ಕ್ಯಾನ್ಸರ್ ಇರ್ಬೋದು ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಅವಾಗ ಗೊತ್ತಾಗಿದೆ. ಇದು BC ನಲ್ಲಿ, ಇವಾಗ ನಾವು AD ನಲ್ಲಿ, ನೆಕ್ಸ್ಟ್ ಬಿಫೋರ್ BC ನಲ್ಲಿ. ಅದಾದ್ಮೇಲೆ ಹಿಪ್ಪೋಕ್ರಾಟಸ್, ಹೂ ಇಸ್ ದ ಫಾದರ್ ಆಫ್ ಮೆಡಿಸಿನ್, he studied about further things about cancer, and he gave a term called carcinos, carcinoma. Carcinoma means it's a Greek language for cancer. Andre carcinoma anta andre literal meaning okay, carcinoma means crab. Crab is the one where it has a single body and multiple legs. Carcinoma means it indicates cancer. Why? Because like crab, cancer has a single primary tumor and it spreads like the crab legs. Adukoskara carcinoma and it becomes carcinoma. Carcinoma and the carcinoma it was turned into carcinoma. Then later, Celsus and the scientist, he gave the term cancer because cancer is the term for crab in Latin. Latin language, cancer is carcinoma in between. So later, Galen was one scientist who gave a term called oncos. Oncos means a spelling. Now, Kannadadalli gantroga anta ಹೇಳ್ತೀವಿ. Oncos means a spelling. Any gantu which is called a spelling in English. So any spelling can be cancerous, not always, but can be cancerous. That is called as onco. So we use the term medical oncologist, surgical oncologist, or radiation oncologist. Oncology means study of cancer. So this is cancer. Now today we take some brief introduction about what is cancer, how it is diagnosed. So cancer is an uncontrolled autonomous division of cells resulting in an abnormal growth. So our cells will have a normal controlled growth. There are factors which prevent abnormal multiplication of the cells, and also there are cells which prevent them from dying also. So apoptotic growth factors, anti-growth factors will also be there. And if detected in early stage, cancer is curable. So this is a symbolic representation. This is normal epithelium. This is the basement membrane, normal epithelium. Normal cellular growth, one cell divides into two and two divides into four, like that exponential multiplication happens in cells. But whenever that control gets lost because of several factors, because of genetic factors, because of loss of cellular growth factors, that leads to a tumor. Once again, tumor means swelling. That's the medical term. Tumor means swelling. So a tumor is formed. This is the normal cells and this is the tumor cells. So this is the uncontrolled growth. So here, this is the normal cell division, where when the cell becomes old, which cannot divide, then normally what happens, it becomes apoptosis. Apoptosis means it's called a programmed cell death. Programmed cell death, when cell when it gets aged, then it will die because of lack of nutrition and other lack of other cytokines and all. Then, but here what happens in cell division? There is a mutation, and when there is a second mutation, after third mutation, inhibition, which tumor, that is nothing but cancer. So whenever there is a lack of relation, so who can get cancer? Cancer can affect right from birth, right from infants to like only old age people will get cancer. It's not like that. ಯಾರು ಬೇಕಾದ್ರೂ ಬರ್ಬೋದು, ಗಂಡಸರಿಗೆ, ಹೆಂಗಸರಿಗೆ, ಮಕ್ಕಳಿಗೆ, any are not same. ಈಗ ಒಬ್ಬರಿಗೆ ಒಂದು ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ, ಅದೇ ತರ ಇನ್ನೊಬ್ಬರಿಗೆ ಅದೇ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ ಅಂದ್ರೆ it won't behave in the same way. All cancers are not same. All cancers don't behave. ಈಗ ನಮ್ಮಲ್ಲಿ ಸುಮಾರು ಜನ ಪೇಷಂಟ್ಸ್ ಗಳೆಲ್ಲ ಬರ್ತಾರೆ, ಪೇಷಂಟ್ ರಿಲೇಟಿವ್ಸ್ ಎಲ್ಲ ಬರ್ತಾರೆ. ಸರ್ ನೀವು ಈ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾ ಇದ್ದೀರಾ, ನಮ್ಮ ರಿಲೇಟಿವ್ಸ್ಗೆ ಇನ್ನೊಬ್ಬರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಆಗಿತ್ತು, ಅವರು ಬೇರೆ ತರ ಕೊಟ್ಟಿದ್ರು ಅಂತ. ಸೊ ದಟ್ಸ್ ಆಲ್. ಅವ್ರಿಗೆ ಬೇರೆ ತರ ಕ್ಯಾನ್ಸರ್ ಇರುತ್ತೆ, ಬೇರೆ ಸ್ಟೇಜ್ ಇರುತ್ತೆ. ಅವ್ರಿಗೆ ಕ್ಯೂರ್ ಆಗಿತ್ತು ಅಂತ ಹೇಳ್ತಾರೆ, ನೀವು ಕ್ಯೂರ್ ಆಗ್ತಲ್ಲ ಅಂತ ಹೇಳ್ತೀರಿ. ಏನಕ್ಕೆ ಅಂತ ಅಂದ್ರೆ ಬಿಕಾಸ್ ಆಲ್ ಆರ್ ನಾಟ್ ಸೇಮ್. ಅವ್ರಿಗೆ ಬೇರೆ ಸ್ಟೇಜ್ ಇರುತ್ತೆ, ಬೇರೆ ಕ್ಯಾನ್ಸರ್ಸ್ ಇರುತ್ತೆ, ಮತ್ತೆ ಬೇರೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಇರುತ್ತೆ. ಹಾಗಾಗಿ ಸೊ ಎಲ್ಲೆಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಬರ್ತದೆ ಬಾಡಿನಲ್ಲಿ, ಎಲ್ಲಾ ಕಡೆ ಬರ್ಬೋದು ಕ್ಯಾನ್ಸರ್. Cancer patient can get cancer at any organ, and as per the statistics, the most common cancer in males is lung cancer in India, and most common cancer in females is breast cancer. So you can get lung cancer, breast cancer, skin cancer, colon cancer, prostate cancer in males, and ovarian cancer in females, and cervix cancer in females. Again, urinary bladder can also have cancer, and even penile cancer. We are seeing so many cancers in penis also. Penile cancers and germinomas, scrotumal birthday cancer, testicular cancers, germinomas and germ cell tumors. So germinomas and leukemias. Apart from cancer, there are 3 terms in cancer. One is carcinoma, one is lymphoma, and one is sarcoma. Carcinoma means any solid cancer. Andre organs baruvanta cancer carcinoma anta helti. The muscle, bone, soft tissue cancers arising from muscles, bones, and soft tissues are called as sarcomas. And cancers arising from blood cells like RBCs, WBCs, platelets, idರಲ್ಲಿ ಬರುವಂತ ಕ್ಯಾನ್ಸರ್ ಗಳಿಗೆ we call it as lymphomas or leukemias. Lymphomas allu kuda innondu lymph nodes anta. Our body consists of lymph nodes. There is a parallel drainage like blood system. Lymphatic drainage is there, like a parallel drainage, like blood circulation. So this drainage happens to stations called lymph nodes. When cancer happens in these lymph nodes, it is called as lymphoma. So basically there are 3 types, broad categories: carcinomas, sarcomas, and lymphomas. So apart from that, as I told you, cancers arising from fat, bone, and muscle is called as sarcomas, and lymph nodes, lymphomas, and bloodstream carcinoma. So these are the estimated new cases in 2020 as per the Globacon. Globacon is an international statistics which gives the estimated number of cancers. We have number 1 cancer in India, that is lung cancer. Next to that is the prostate cancer in males and colorectal stomach cancer. In females, we have majority breast cancers, then colorectal cancer, then lung cancer, and cervical cancer. Cervical cancer are most common in females, that too in the rural population. And this is the top 5 leading, once again the same slide, the top 5 leading sites of cancers in males: lung, prostate, stomach, esophagus, and mouth, and in females: breast, cervix, ovary, corpus luteum, and thyroid. So once there is a cancer, it multiplies, as I told you, as I showed you in the slide, it multiplies in the cells and the size of the cancer increases. But it won't stay there for long time. Once it increases, the size increases, it invades the blood vessels and it reaches the bloodstream. Once a cancer blood go, then these cancer cells circulate in the blood and they can get lost in any part of the body. Either it can be bones or other organs. We can see an example where breast cancer can go and lodge in lungs, bones, brain, spread out. So that is what is called as metastasis. So metastatic cancer is called as stage 4 cancer. Stage 4 and once the cancer spread to other organs of the body, then it is called as metastatic cancer. Now coming to the causes of cancer. The major cause of cancer, 90% of the cases, is because of environmental factors, that is smoking, tobacco. Majority is tobacco. 30% cases of tobacco. Apart from that, viruses, occupational factors, occupational exposure, like asbestos, then alcohol, then radiation, a small amount, previous radiation. Radiation, if patients are treated earlier with some radiotherapy and all, they can also get cancers at later stages of life, like that. And sunlight, diet, unhealthy lifestyle. This is the main reason next to smoking. So, and last, this is the most important, 5 to 10% of the cancers are because of the genes, hereditary cancers. So that includes 5 to 10% of the cancer. Now coming to the first common cause which can be preventable is smoking, tobacco. There are 2 types of tobacco. One is chewable and non-chewable. Chewable tobacco means Chinese, Gutka, Jarda, Rajnigandha, what will then use Kadisopu, Ogepudi, and Tala Upyogstare, adella non-smoke tobacco. Smoke tobacco antandre smoking tobacco antandre cigarettes, BDs. So itaradella smoking tobacco. So this is smokeless tobacco and this is smoking tobacco. So when it comes to smoking, almost there are more than 60% of chemicals which can cause cancer. More than 60. Out of the 60, these are the important ones which I have labeled for. All are used not only in, all are used for other purposes. Like just what you call carbon monoxide will be released, methanol will be used for rocket fuel, ammonia is used as a toilet cleaner, which is there in smoke. Nicotine is used as an insecticide, and hexamine is used for barbecue lighter. Stearic acid is for candle. So there are so many chemicals which are used for other purposes, but that will be the tobacco. When a person gets exposed these type of chemicals, then there are higher chances. This is the highest, most risk factor for getting a cancer. So in smoking, there are two types. One is active smoking and one is passive smoking. Person who is smoking by himself, that is called as active smoking. Person who inhales the smoke without smoking, that is called as passive smoking. We'll get a lot of patients, normally female patients who comes with lung cancer. They don't smoke and they didn't have a habit of tobacco also, chewing tobacco also they have, but still they got cancer. Because of passive smoking. So whenever a patient comes with diabetes, we take a history like what is their family people, or husband hegidare, husband smoke ಮಾಡ್ತಾರಾ, husband manile smoke ಮಾಡ್ತಾರಾ, ಜೊತೆಲಿದಾಗ smoke ಮಾಡ್ತಾರಾ. If a person non-smoker, if a male patient comes with a non-smoker comes with a cancer, then whether he is in close contact with any of his friends who is smoking. So all this makes an impact. So passive smoking is also as dangerous as active smoking. Now, tobacco, what and all can cause, which are the cancers which can cause? Mouth and throat cancers is the most common. Adrenal cancers caused by tobacco. Most common cancers, and then digestive system like esophageal cancer, stomach cancer, pancreatic cancer, colon cancer, bladder cancer, and uterine cervix cancer. Pelvic can also cause blood cancer also. Smoking can also cause blood cancer. Then voice box means laryngeal cancer, lung cancers. So we commonly see lung cancers and adrenal cancers with smoking, and smoking is also related to so many other cancers. So the most common risk group is men, African Americans, people living in countries with low education status, and people living in countries with high poverty. So these are the risk factors along with the smoking. Why this quitting means smoking? Quitting smoking is hard. Why? Because nicotine quickly goes into the brain as quickly as 7 seconds. Once you smoke, within 7 seconds, it goes to the brain, and you feel relaxed and good, and your nicotine levels fall quickly after smoking a cigarette. So that time, at the time of smoking, they don't feel like any nausea or anything observed while smoking. So they feel like good. That is the reason why people get addicted to smoking, and you feel craving for another cigarette again, and you think, I want to smoke, or feel irritable or restless without it. So these are the reasons why it is very hard to quit, but you have to quit, or else you will be next. Whenever you consume cigarettes along with alcohol, then the risk factor doubles. Because in studies it has been proven that whenever you smoke cigarettes along with alcohol, then the absorption of the smoke inside the lungs and also inside the digestive system increases. So people are like, ನಾನು ಇಲ್ಲ ಒಂದೊಂದ್ಸಲ ಯಾವಾಗಲೂ ತಗೋತೀನಿ, actually daily smoke ಮಾಡೋದು alcohol ಎಲ್ಲ ತಗೊಂಡಾಗ ಇನ್ನೂ ಜಾಸ್ತಿ smoke ಮಾಡ್ತಾರೆ. That is more dangerous. So for all, quit smoking. That is better. Even alcohol can cause 7 types of cancers, that is mouth and throat, larynx cancer, esophageal cancer, breast cancer in women, liver cancer, and bowel cancer. So smoking and alcohol are the biggest risk factors for cancer. So always try to quit and help other people for quitting these habits if they are nearby you. Along with that, unhealthy lifestyles, sedentary lifestyles, junk foods, and more spicy foods, oily foods, and all this lack of exercise, all this unhealthy food habits leads to cancer. How? Because of obesity. Obesity is related to so many cancers like breast cancer, ovarian cancer, lung cancer. So unhealthy life habits is the next risk factor. And next, last one is, as I told you, 5 to 10% of the cases has got hereditary cancer. So a person, Orwell Einstein, has told genetic loads the gun and lifestyle pulls it together. There is one more slide in the later presentation. This is, so already if you have a risk of cancer through hereditary, genetic mechanism, through you have some mutation, when you are exposed to this risk factor like smoking, alcohol, the chances of getting cancer becomes 10 times, 20 times. So genetics already has loaded, but lifestyles can help to prevent it, or sometimes the lifestyles are not good, then it can pull the trigger. So always try to have a healthy lifestyle. Now, how to do prevention? What's the prevention method? Before going for diagnosis and treatment, I like to have some throw some light on prevention. There are 3 levels of prevention. One is primary prevention, secondary prevention, and tertiary prevention. Primary prevention, avoid development of the disease. Before the disease comes, you avoid. That is, avoid risk factors that develop the cancer and have a healthy lifestyle, remove the risk factors. Secondary, early detection and proper treatment. That is the secondary prevention. So whenever you have some unexplained symptoms, I'll come to it, unexplained symptoms like swelling or some unexplained cough, weight loss, loss of appetite, reduced appetite, then you have to have a good health checkup and show it to a specialist and confirm that you don't have a major disorder. So early detection, always in cancer, early detection saves lives. Then the tertiary, reduce complications of established disease. Tertiary prevention means to prevent the comorbidities related to cancer. That is almost like a rehabilitation. This is once again the effects of quitting smoking. Within 20 minutes, the heart rate and the blood pressure drop. Within 1 year, risk of coronary heart disease about half that of smoker. Carbon monoxide levels and blood drop. And 5 to 15 years, within 5 to 15 years of quitting smoking, the risk of stroke is reduced of that of a non-smoker. So the risk of coronary artery disease is that of a person who never smoked after 15 years. So I think it's too late. To have a healthy lifestyle by having a healthy food, where your wholesome food should contain vegetables, fruits, whole grains, proteins, along with adequate amount of water and healthy oils. Along with that, you can have if you are a non-vegetarian, you can have a proper meal with fish, egg, and other cereals and fruits and vegetables, along with milk, and exercise. Exercise, daily exercise, that is the main key factor. So healthy living, regular exercise, diet plan, weight loss, obesity, you need to reduce the obesity, positive attitude, better sleep, and proper nutrition. So these are the factors which can have a healthy living and thereby prevents cancer, not only cancer, other coronary artery diseases like heart diseases, respiratory diseases, and everything. So this is the 4 hormones. It's called happy hormones. You need to get this daily dose of hormones. One is dopamine, which enables the motivation, learning, and feeling of pleasure, gives you determination to accomplish goals. So when you have a healthy lifestyle, these hormones will be released in the body. You exercise ಮಾಡಿದಾಗ ಒಳ್ಳೆ ಫುಡ್ ತಗೊಂಡಾಗ ಜಂಕ್ ಫುಡ್ಸ್ ಎಲ್ಲ ಅವಾಯ್ಡ್ ಮಾಡಿ ಎಲ್ಲ ಒಳ್ಳೆ ಫುಡ್ ತಗೊಂಡಾಗ then you have all these hormones. These are called healthy hormones: dopamine, serotonin, oxytocin, and endorphin. Endorphin releases the brief euphoria to mask physical pain. So whenever you exercise, endorphins release ಆಗುತ್ತೆ. After exercise, you feel good, you feel lighter. That is because of endorphin. Serotonin, feeling significant and important among peers, and form of accepting yourself with the people around you. So anger, reduce anger, meditation, everything helps in preventing cancer. Early detection of cancer. This is the secondary prevention, where early detection of cancer. Does it really make a difference? Yes, it will make a difference, because early detection, it cures the cancer. There is less intensive treatment, less trauma, less pain, cost is less, and early stage, almost 80 to 90% of the cancers get cured if detected in early stage, and in the late stage, 20 to 30% of the cancer. But the reality is in India, 80% of the patients with cancer come with the later stages. They neglect. Then they come to the specialty centers at the later stages. And 71% of the deaths occurs between 30 to 69 years in India, whereas it is only 50% in here because of higher education and higher awareness in cancer. 70% of the patients die in first year in India due to late detection. So when they come to us, most of the patients will have later stages. For example, lung cancers. Hardly in India, we detect only 20% of the cases in early stage in lung cancer. Other 80% of the cases will come at later stages with bone metastasis, brain metastasis, and liver metastasis. Then 50% of the cancer from lifestyle factors, obesity and tobacco use, and children, it is 15% in children in India, whereas it is global average is 0.5%. So, what are the signs we need to look for whenever we are talking about cancer? That is unexplained lump or swelling, bleeding that is not normal. Morning when you brush, some amount of blood coming from your gums and all, it's normal. But some blood coming in your stools daily or from your nose, unexplained bleeding, that is an important indication you need to evaluate it. Then comes persistent cough, any breathlessness, shortness of breath while doing exercise, while walking and all. Then any change in voice, any chronic ulcer in the mouth, that has to be evaluated. ಬಾಯಲ್ಲಿ ಒಂದು ಗಾಯ ಆಗಿದೆ, ಸುಮಾರು ದಿನದಿಂದ ಇದೆ, ಕಮ್ಮಿ ಆಗ್ತಾ ಇಲ್ಲ, ಒಂದು ವಾರ ಕಮ್ಮಿ ಆಗ್ತಾ ಇಲ್ಲ, after 10 days also it's not getting healed, then that needs to be tested. After that, constipation, chronic constipation, not acute constipation, chronic constipation is sometimes blood in the stools. Some of the patients have they neglect because of piles. So namgeno piles it anta neglect ಮಾಡ್ತಾರೆ, but that is one risk factor, that is one common symptom of colon cancer, rectal cancer, colon cancer ke blood in the stools is a most common symptom. Oral cancer, so these are the signs and symptoms: white or red patch on the lips or gums, hoarseness of the voice, and swelling of the jaw, bleeding from the mouth, chronic bleeding from the mouth, loosening of the teeth, soreness in the mouth that doesn't heal, like this. So this is an ulcer. Normally ulcers ಎಲ್ಲರಿಗೂ ಆಗುತ್ತೆ, ulcers is not a major thing, but non-healing ulcer, chronic non-healing ulcer is a common symptom of cancer. Teethalaಗಿದೆ ಮತ್ತೆ ಇಲ್ಲಿ patch is a white patch here. Then coming to lung cancer, warning signs are chronic cough, coughing out blood, we call it as hemoptysis in our medical terms, coughing out blood, change in voice, chest pain, shortness of breath. The risk factors I told you once again: smoking, asbestos, coal tar, derivatives, and radiation. So these are the common symptoms: persistent cough, shortness of breath, coughing of blood, shoulder, arm, chest or back pain, repeated respiratory infections. That is one more thing, repeated respiratory infection. Ingeno asthma ide, adike sumaru varshadinda ide, nangeno aagta illa, paravagiಲ್ಲ, ಹೆಂಗೋ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡ್ರೆ ಸರಿ ಹೋಗುತ್ತೆ. Don't neglect. You need to have proper thorough checkup. So this is the difference between a smokeless lung and a smoked lung. It becomes completely fibrosed. I think most of us seen this picture in theaters. When it comes to breast cancer, what and all you need to have. If there is a lump here, either in the armpit or somewhere in the breast, if there is a discharge from the nipple, any skin changes, any nipple change. So any pain or red or swollen breast, all these are signs of breast cancer. So early detection of breast cancer is 80 to 90% of the early breast cancers are curable. More and more awareness has been created, so we can able to get some early breast cancer cases so that we can treat them properly with surgery, chemotherapy, and radiation, so that we can cure. But one more thing is cervical cancer. One cancer which is preventable is a cervical cancer, because we have a vaccine for cervical cancer. No other cancer has a vaccine. Because cervical cancer, the most common cause is HPV, human papilloma virus. There is a vaccine for human papilloma virus. All girls from 10 to 12 years needs to get vaccinated for cervix cancer. It has to be a part of a immunization schedule along with other vaccinations. And even up to 26 years, people can get vaccinated. Up to 26 years, the benefit is quite less, but still. So up to 26 years, anyone can get vaccinated for cervix cancer. So once again, warning signs of cancer: any cough, oral habits, sore in the mouth. Now, what are the tests to be done to detect cancer? There are three types of tests. One is blood test, radiological test like scans, and histological test, pathological test for like biopsy or FNAC. We call it as biopsy or FNAC. So blood test will have some tumor markers in the blood test. Radiological test, we have X-ray, CT scans, PET CT scans, the newer modality of scan, that is CT scan, MRI scan. All this can have detection of where and all the cancer has been spread. It helps in staging of cancer. Basically, radiological test helps in staging of cancer, and histological test helps in detection of cancer. So liver function test, CT scan, CBCs. This is the biopsy, where whenever there is a tumor, we put a small needle. It's not a major procedure. We put a small needle there and take some amount of tissue that is taken to the lab and get a report. That is the pathological diagnosis. Now coming to stages of cancer. Overall, I don't go in detail of stages. Stage 1 cancers are localized only in that part, depending on the size. Stage 2, a bit of bigger size. Stage 3, the cancer spreads near the surrounding structures there itself. And stage 4, as I told you in the first slide, where it has spread to other organs or other parts of the body. That is a stage 4 cancer. Now come to the modalities of treatment. Basically, there are three modalities of treatment. One is surgery, one is radiotherapy, and one is chemotherapy. So, when it comes to surgery, this is the evolution of cancer treatment. First, there was surgical treatment. BCL, Munche Yadaru, Ganpatandra, Takshna, they would have removed, they were removing the whole tumor. They were removing it earlier. Then came in 1940, what happened? During the Second World War, the nitrogen, they were using nitrogen mustard gases, mustard gases for atomic bombs. The soldiers who were exposed to this mustard gases had a low blood count. Their total WBC count, total platelet count was becoming low. So they examined these soldiers and they found out that this mustard gas can have some effect on abnormal cells or normal cells also. So they can be used to treat these abnormal cells. That's how they engineered, and then they found out one first drug, that is nitrogen mustard, is the first chemotherapeutic agent which was which came into the market, and they treated it with for leukemias, basically one for leukemias. Leukemia, as I told you, the blood cancer. So nitrogen mustard was the first chemotherapeutic agent which was done, that is in 1940s. So this is 1940s. After that, so many other agents came, like targeted chemotherapy. The difference between the chemotherapy and targeted therapy: chemotherapy doesn't differentiate between the normal cells and the cancer cells. That is the reason why most of the patients will ask, chemotherapy has got a lot of side effects. Why? Because chemotherapy kills both cancer cells and both normal cells, means both cancer cells and normal cells. Chemotherapy cannot differentiate between the normal cells and the cancer cells. Whereas targeted therapy targets only the cancer cells, don't kill the normal cells. That is the reason side effects with targeted therapy are less, and side effects with chemotherapy are more. And chemotherapy kills the cells which are more active, which are more dividing. So, Yava cells which are in the active phase of dividing, our cells it will affect more chemotherapy. That is the reason why most of the people on chemotherapy have hair loss. Hair loss and the hair cells that will divide more. That has an active multiplication all the time. And also the gut cells, GI, esophagus, stomach cells, divide active. It divides the multiplication and faster. So when these cells are becoming active, more and more multiplication, these cells are prone for killing by chemotherapy agent. So you will have a lot of gastritis, loss of vomiting. So the three common side effects of chemotherapy are: one is alopecia, we will call it as hair loss. Second one is nausea and vomiting, and third one is diarrhea. This is the reason why all these side effects, because of increased multiplication of all these cells. But targeted therapy don't have this side effect because it targets only the cancer cells. Now in 2010, we got checkpoint inhibitors, that is immunotherapy. Rajshekar sir has told that is the that is the area of interest. Immunotherapy. Immunotherapy means boosting their own immunity and making these immune cells to fight with the cancer cells. So immunotherapy has also got lesser side effects when compared to chemotherapy. Now coming to the surgery, some aspects of surgery. Earlier we used to do surgery for all, means removal of the organs, but that has a physical impact, also a mental impact on the patient, losing an organ. So psychological impact was more. Then it came organ preservation surgery. So they used to preserve the organ. They used to remove that part of the body. Only the cancer lump was removed, preserving that exact organ. For example, in breast. Earlier they used to do complete mastectomy. Complete breast remove ಮಾಡ್ತಾರೆ. ಇವಾಗ only lump ಮಾತ್ರ remove ಮಾಡಿ ಜೊತೆಗೆ chemotherapy treatment radiation ಎಲ್ಲ ಕೊಟ್ಟು we can cure breast cancer retaining the breast. So that is called as BCS, breast conservation surgery ಅಂತ ಹೇಳ್ತೀವಿ. Breast conservation surgery instead of mastectomy. So ಇದರಲ್ಲಿ ಇಲ್ಲಿ lumpectomy ಅಂತ ಮಾಡಿದ್ದಾರೆ. You can see this is the area site where the lump has been removed, but here this was earlier where mastectomy we were doing mastectomy, completely all of the breast. But sometimes ಏನಾಗುತ್ತೆ, even the cancer will be there in that organ where we can't preserve it. For example, one more slide about the organ preservation. This is, I want to tell you this about this patient, young female patient, 25 years old, married 1 year back, and she was diagnosed as having alveolar rhabdomyosarcoma. This is, as I told you, sarcoma is a cancer which develops from bones, soft tissues and all. And she developed this rhabdomyosarcoma of the orbit. Orbit means it's a bone which protects the eye, orbit in the skull. So she had developed this. She came to JSS Hospital. This patient was treated at JSS Hospital. Then the main treatment was complete removal of this eye. Complete exenteration of the head. Call it as exenteration, complete removal of this eye. But because of chemotherapy, because of radiation, we thought of organ preservation. We spoke to the surgeons, we spoke to the radiation oncologist, and then we started treating her with the chemotherapy. The chemotherapy was given almost for 44 weeks. 44 weeks, almost like 10 months and months. Then we avoided surgery. Later, this is the result. So, without surgery, this patient is still coming for follow-up. 1 year post-treatment, she's doing fine, she's doing better. So, like this, organ preservation can be done with proper treatment. Only thing is, the treatment has to be right treatment and it has to be in proper hands. So, this is about organ preservation, and now organ preservation surgery is also there for laryngeal cancers, where earlier they used to remove the whole larynx. If it is in early stage, only radiation can be given to cure this laryngeal cancers, and this voice box, voice, everything can be preserved with organ preservation, with proper treatment. Now, sometimes what happens, this is one more case of tongue cancer, tongue carcinoma. She was a chronic tobacco chewer, which came with complete lesions of the tongue, unable to swallow the foods, unable to take liquids also. So she came and the treatment was surgery, but even surgery can't be done because of extensive disease. Inside the mouth, it has spread to the buccal mucosa here in the mouth and also down to the throat. So surgery was not possible for her. We gave chemotherapy. She tolerated the chemotherapy well, and this is the result of that patient. So like this, we can preserve the organ by proper treatment. And if we cannot preserve the organ, suppose if it's that site where complete removal has to be done, can't preserve the organ, then it is inevitable, we have to remove that organ. But when we remove that organ, there is an option of plastic surgery. This is plastic surgery in head and neck, where they do a flap surgery for head and neck. This is a carcinoma of the alveolar region. In the alveolar means lower teeth, lower gum region where cancer was there. That was removed, chemotherapy was given, radiation was given, and plastic surgery was done. And as Girish told like Angelina Jolie underwent bilateral mastectomy because of BRCA gene mutation. So when she underwent bilateral mastectomy, she had breast implantations, artificial breast. So that is how the cosmetic surgery, this is the breast implant which can be done. So there is a treatment for everything. There is a treatment, but you need to have a proper guidance. You need to be aware of it. Next comes after surgery. Next comes radiation. Radiation controls local recurrence of the disease as a curative treatment in head and neck, cervical, and esophageal diseases. So radiation treatment is nothing but a higher dose of X-ray. It will be like a CT scan. Most of the patients has a doubt. What is radiation? Current current treatment. Current shock just nothing will happen. This is the radiation treatment. This is the radiation machine, just like how you lie down for getting a CT scan. So when you lie down for a CT scan, no interventions, no pricking, nothing. Just will be there for 5 to 10 minutes, and then you can that treatment will finish. This will be done for 1 month, not longer also. 1 month, 1 to 1.5 months, we will finish your treatment. So this is the radiation therapy. And coming to systemic treatment, that is my area. Systemic treatment. When it comes to systemic treatment, this is a slide of breast cancer treatment. When it comes to systemic treatment, we have, as I told you, chemotherapy, biological therapy, targeted therapy, hormonal therapies, and immunotherapy. There are different treatments, but all these treatments are given through IV, intravenous treatment, intravenous access. Just like you glucose and bottle and hospital. Some patients will have that myths about chemotherapy that it will have a burning sensation, it will have a painful sensation. Apart from some side effects, as I told you, like hair loss, that too in some chemotherapy agents, not in all. Hair loss is not in all treatment agents, but it is only in few regimens. And some nausea and vomiting, that too for a few days after treatment. After 4th or 5th day, patient will be completely fine. And to tell you, all these chemotherapeutic treatments or the side effects because of this treatment are temporary. Once patient finishes the treatment, patient will become normal. He'll get patients will get their hair back, and all these side effects of nausea, vomiting, diarrhea, everything will get reduced, and he'll feel better. But the effects of cancer tumor, most of the people will be afraid of chemotherapy. Side effects are but if you don't take treatment, then the effects of cancer is irreversible. Cancer in the one it is irreversible, but the side effects of chemotherapy is reversible. That's what I tell to all my patients. Now, as one slide was there, that genetics loads the gun and lifestyle pulls the trigger. This is if you have a mutation, already genetics has loaded. Then if you are exposed, then there is very much high risk of getting cancer. If you have a mutation and there is no exposure, then also you can get cancer. This is where some of the patients come, kudiyalla, cigarettes sedalla, non-veg tinnalla, horgade uta madalla, but still I got a cancer. Why? Because of your genetic makeup. And if you have no mutation but exposure, then it is equal to mutation with no exposure and is called as a moderate. If you have no mutation and no exposure, still you are not safe. Still there is slight amount of risk of getting cancer. And this can be mitigated with lifestyle and early detection. This can be treated with early detection. That is the reason why we are already loaded with the genes we don't know. There are almost studies going on for examining these genes. Everything is there inside the body, the whole genome sequencing. It is done, but we don't know. So this is the whole genome sequencing. All people who can get what diseases, everything will be here. So it depends, you get or not, that depends on your lifestyles. That depends on how you be in your life. Now the cancer treatment is changing day by day. It's not like every patient will get the same treatment. Suppose if 2 persons are there, A and B. A has got lung cancer, B also has got a lung cancer, the treatment won't be same for A and B. Because there are tests, as I told you, the genome sequencing. If you run this test, then A patient will have some genes which are susceptible to some drugs, and B patient will have some genes which are susceptible to some drugs. So the same drug won't work for both the patients. That is how in lung we have adenocarcinoma, where these are the mutations, KRAS, EGFR, ALK, BRAF, mutations in them. So for EGFR, this is the most common mutation in the lung. If patient is a non-smoker, if he gets lung cancer, then there are 40% chances that this mutation is positive. Good thing is, if this mutation is positive, then patient can be treated with only tablets, without chemotherapy, without lot of side effects, and has got a good survival in stage 4 disease. Good overall survival in 4 stage disease. Just 10 more minutes, I'll finish. Then this is lung cancer, and for just like EGFR, ALK mutation also has some drugs where we can target these ALK mutations, and patient will have a normal life with good control of the cancer, like that breast cancer and head and neck cancers, melanoma, colorectal cancer. So these mutation studies will be done on a routine basis for all patients. So one treatment doesn't fit for all patients. We need to look in for their genetic makeup, their mutations analysis, and then we need to go for it. In a bunch of cancer patients with the same diagnosis, some patients will have a good response, some patients will have a poor response. In those patients, we use different drugs depending on their test results, and for some patients, the drugs will cause more side effects. In those patients, to reduce the dose of the drug. So suppose, for example, in breast cancer, earlier it was like only big tumors will have a spread of the disease and small tumors will don't have a spread of the disease. But now it is different. Because of this genetic tests and all, we have come to know that even a small tumor can be more aggressive, can have a metastasis when compared to these large tumors. So these small tumors has to be taken care of in the same way as large tumors. We cannot neglect those small tumors. But irrespective of the size, we have this genetic molecular classification of breast cancers, not like ENM staging. There is another classification like molecular classification of breast cancer. This is ERPR positive liminal A and other classification. Depending on this classification, we decide treatment for the breast cancer patients. And this is just like an example of stomach cancer patients. And after all this is immunotherapy. As I told you, immunotherapy, this is the tumor cell and this is the T cell, where the tumor cell inhibits the T cells by blocking some of the receptors here. What immunotherapy does, immunotherapy prevents this blocking of tumor cell with the T cells and activate more number of T cells, and these T cells in turn act over the tumor cells and kill those tumor cells. That's how the immunotherapy works. So this is the hot topic nowadays. Immunotherapy has less side effects, but the only constraint is the cost. It has, because in India, that is the main constraint. In US, UK, and other countries, most of the patients will have insurance. So everything will be covered under the government insurance scheme. But here in India, we have to pay from pocket. We have, unless we have some insurance schemes and other. So right now, this immunotherapy is quite costlier, but in coming days, it will be available to all the public. And this is the new immunotherapy. I think most of us have read in social media, in WhatsApp papers, that one drug has come all of a sudden and it has cured all rectal cancer patients. This is the drug, dostarlimab. But the thing is, this study has been done only in 12 patients. This is not a large study where we can generalize this drug to all the patients. And moreover, this drug needs further studies and has to be applied for other patients, and then it will be can be utilized for treatment of cancer. But it has got a wonderful effect in 12 patients, where all patients have got 100% response in rectal cancer patients. And the last thing is, this we are seeing in the social media, but my advice is, whatever you see in the social media, don't agree for all the things and don't believe all the things, because whatever is in social media is not true. Okay, most of the patient comes with Googling all those things like, sir, whether this treatment can be done, that treatment can be done. You can't be become a pioneer just by searching Google for half an hour. So you have to come with a clear clarity with what you have, and you have to need awareness. If you want treatment, then you have to be clear-minded, open-minded. So don't search for symptoms in Google. Go to your clinical consultant, go to your specialist, and get treated. If you search for Google for headache, then in the next 5 minutes you will get a brain tumor, and the next 5 minutes you will be on death bed. So don't go for Google. And finally, this is my last slide. The myths about the cancer treatment. Cancer is a death sentence. Of course, cancer is not a death sentence, because right now there are so many treatment options are there for cancer. So many drugs are available, and so many different modalities of treatment are available with minimal side effects. So cancer is not a death sentence, even in stage 4 disease, stage 4. And don't ignore the symptoms. Don't ignore a swelling, don't ignore an ulcer, don't ignore some bleeding, don't ignore a lump, don't ignore anything, get it evaluated. I don't tell that everything what you get is a cancer. Don't get panicked. But if there is an unexplained thing of long duration, then you have to get evaluated. And pain is early sign of cancer. Pain is not an early sign. Pain is not an early sign of cancer. Even in breast lump, most of the females, most of the women will come with a breast lump because they came late, only because it's not painful. So painless lumps can be a cancer. So pain is not an early symptom of cancer. Along with that, and this is one important thing where most of the cancer patients, they'll completely isolate their patient at home. They give a separate room, they give a separate food for them, they give a separate cloth, no cloth mixing and all. To tell you, cancer is not a communicable disease, cancer is not a contagious disease. Cancer is non-contagious. They can live with you, they can have food with you, they can wear your clothes, they can live with you. It's not a contagious, just like other diseases like tuberculosis, of course. Okay, cancer is not contagious. Cancer is a non-communicable disease, not a communicable disease. And then all cancers are hereditary. All cancers are not hereditary. Only 5 to 10% of the cancers are hereditary. But if you have a patient in your family, a close relative, your father, your mother, or if your close relative, a second generation is having cancer, then you need to be more careful. Get early checkups, health checkups properly. Proper healthy lifestyle is important if you have a family history of cancer. So all cancers are not hereditary. So that's all about today's talk. I hope you got some information about cancer diagnosis and treatment. Thank you, Anil.
Thank you very much, sir, for an interesting, knowledgeable, and awareness-creating talk. I request everyone to please join for tea and assemble back in 10 minutes.
If you have any doubts, you can ask for 5 minutes.
The audience are free to ask any queries or interaction during the tea break. We'll have the next talk by Dr. Shivanand Manohar. Thank you. During the tea break, you can interact and ask any queries. Shivanand Manohar J. I call upon Damini to give a brief introduction about Dr. Shivanand Manohar J. Dr. Shivanand Manohar J. completed his MBBS from Medical College and Diploma in Psychiatry from Medical College. He also completed PhD from Kasturba Medical College, Bangalore. He currently working as assistant professor in Psychiatry Medical College, Mysore. He currently working as assistant professor psychiatry, JSS Medical College, Mysore. He is member of AIB, member of Medical Education Unit, fellow of Indian Psychiatry Society. He is also member of Indian Association Biological Psychiatry. Sir has published 25 journals and co-authored 11 books. He has attended 2 state conferences organized by Indian Psychiatry Society, Karnataka chapter, and JSS Center for Management for Studies in the year of 2021 and 22. Over to you, sir.
Thank you for the wonderful introduction. First of all, at the outset, I always thank Malini madam. Basically, we as clinicians working in the hospital, reaching out to scholars like in Mysore University, was always a Herculean task. Because so many research you do, it is not translated there. So many things what we do is not understand at the academic level. So somewhere I always give a big round of applause to madam. Please give a big round of applause to madam. Because she's the one who is bridging the gap. I always pray God that madam should occupy bigger positions, and it will be a big advantage in future for the human being, because every information is getting doubled in 2 years. Whatever you have learned, in another 2 years it becomes obsolete. Okay. So this is one area which I was not at all aware of in 2 years, 3 years back. This area, I started working with the COVID pandemic started. So, what is this resilience? Like there are a lot of scientific scholars here. Like it is a physics terminology. When, for example, this is file. I apply pressure on this file like this. After the pressure is released, it should come back to its normal level. Okay, that is resilience. You are better than us because you are basic scientists in university. More than us, you know about it. So, what is this resilience having role in human beings is the question. So, I'll come to that point. Why it is very important in cancer patients? We start here. What I am looking at, what is actually happens when a patient, like now Dr. Kiran had spoken about different cancers, like their causes, etiology. After the person comes to know that he is having a disease which has a poor prognosis, how does he respond to that? And how is response to his condition in terms of his psychological reaction is the one which determines how long does he survive. Like one study we had done in Kidwai Memorial Hospital in Bangalore, where when people, we interviewed a lot of people who accepted that they had a cancer and were positively reacting to that. What is positively reacting to that, or what is post-traumatic growth, and all I will be discussing in the future slides. Just for an introduction purpose, we calculate 5-year survival rate in cancer. Like, after the diagnosis of cancer, whatever the stage might be, how many people of them will survive more than 5 years? So, when we looked at that, these patients who had a good positive thinking, good understanding about the condition are the ones who survived more than 5 years, 10 years. Similarly, I had one patient who used to come to me from Tagara. Tagara, you may be knowing that. From there, he used to come. He was diagnosed with HIV in 2001. And his CD4 count at that time in 2004, one itself was 64. CD4 count was 64. But till now he is surviving. That AIDS manifestation has not happened. So, somewhere, how we identify the challenge. First of all, defining the issue, what the problem is, then what are the challenges we have, and what are the communication barriers they have when they are discussing. It may be the language at times it always be as doctors, for example, when they come to us, first thing we want to know is what are the symptoms they have for us to make a diagnosis. That's all we concentrate. Plus, I'll be in my OPD at around 1:30. I'm already very hungry. One patient comes to my chamber and he starts telling that I am this minister is there, not minister, daughters. Somewhere around we'll be beating around the bush. And actually, in my mind, I get a thought, let him tell what is his problem. I am hungry, he is also let us. But the biggest issue is that if I listen to him, the basic thing he wants to convey to me that is important. So that's why he's telling so many references like that minister I know, this I know, everything he's telling. Finally, my concept is let him tell his symptoms so I can treat it. Somewhere we always become very reductionistic when it comes to communication. Like whenever we talk to you, how are you? What is your problem? How can I help you? That you concept is very, very important. The communication is the most important thing to understand people. Then this is the one which gives you a better understanding how you can improve your clinical practice. Like when I finished my post-graduation almost 2 years back, I came to Mysore after working for an year or two in Manipal. When I came, my communication or my clinical practice was only the thing which was only focusing on the what all given in the text. But finally, I understood what all I read is not important. What patient teach is important. Every day is a learning for us. So, first of all, you should know what is their knowledge. Like the knowledge is based on the culture they belong. So, for example, many people come from North Karnataka. They are very good at art, but they start with a filthy language. Art addressing itself is like if at all, I studied in was born in Mysore, studied in Manipal, worked in sometimes in North Karnataka. What initially understood is in Mangalore, if I am talking, they talk the correct grammatic textbook Kannada in Mangalore. If you go to Hubli, Dharwad, or furthermore, Bidar, they start with some language which is very difficult to digest. Like if at all we start thinking, what is he talking? Is he scolding? That is actually their way of telling that you are my good friend. So, someone should understand what they are doing. And if you want to understand which culture they belong to, is very, very important. Initially, when if a North Karnataka person comes to Bangalore and tell that some go, that will become very huge problem in Bangalore. Mysore, okay, it is in between. So, first of all, we should understand what culture they belong to, and let us basically we should always allow them to share their experience. We think it is not relevant to us. They are telling that only one star. No one is there to take care of. So many things they will be telling. If at all you listen to that, 90% problems are solved. Only thing what we should do is we should reflect on what they are understanding. Like the basic thing what I do is in sitting in my clinic for my hospital is that he's listening, or at the end of 20 minutes, they tell, this is the one, I think I have understood what you are. Like, we should be like a mirror to them rather than putting our own concept. First of all, if you are trying to be a mirror about their understanding, that itself solves a lot of problems. Once you mirror, then they themselves will understand what are the wrong concepts they have having. So, like, how to define the issue? First of all, to define the issue, you should understand what is this physical problem. Physical problem, already Dr. Kiran has spoken to you in detail. Then what is the psychosocial issues there? What is the psychosocial issues means? Which socio-economic status? What is the backup there? What is the culture I told? What culture they belong to? The culture is the one which defines who is a doctor. Culture is the one which defines when they should take them to doctor. Culture is the one which defines who is ill. So each culture have a different definition. Like India is one thing where you see unity in diversity. Like so many cultures are there. Like I was working in a tribal area way back in 2008 to 9. We had one pulse polio January, February. You know that pulse polio. Pulse polio is a huge project for us during government service. So, like I was working in a place called Badagalapura. It is in HD Kote Taluk, and it is the most backward area. And we used to get 5,000 extra salary because we were working in the most backward taluk and the most backward fields. So that time there was a news spreading in the TV that one child who was given this pulse polio had some side effects. Like we were given one van. That van was very old. We used to take that van to get repaired with a tractor. That was looking like an ambulance actually. Whenever you used to push that in your tractor, whole village would look at us like we are some jokers. So in that van, we went to one of the tribal, the Hadis there. So then we went, there were no children all over the place. Then I was surprised to see where are these children. We asked where are the children because we give pulse polio less than 5 years, right? So then I asked where are the children. They told they were all gone to some other Hadis. So there was some noise. You should see those Hadis. Like government has built them the roof houses, but they tie their cows, cattle there. They live in huts. Now that is how they are. Like that is really good. And then one small sound happened in one of those doors. So in that door, I just went and pushed it. Almost 23 children were sitting like this. They had just put them inside that one, and they did not want to use this policy. So that is the culture. Culture, they are in one area where they are really scared of civilization, urbanization. I don't know what we are doing. They are living happily. We are treating them, but how ethically we are correct, I don't know. But still, then I drank some 8 to 10 grams of pulse polio. That polio drop demonstrated that I am alive, and then everyone took that. So the point is how culture defines your understanding. The third thing is this cognitive. What is cognitive is their understanding level. For example, a person is having some cancer which has effect on the brain. So their comprehension itself will be impaired. Their understanding what we talk will be impaired. So whenever you are defining the issue, you should look at all 3 dimensions and then you should act. Because if you start giving this lecture to a person already cognitively compromised, it will be not counseling, it will be burden. So looking at this cognitive abilities, we should look at that. So there is lot of difference in the way each people react to a diagnosis. It is based on their personality. Like what is personality? Like each of us, I am a very talkative person. I keep talking all the time. But our HOD never talks. Who is not much still I don't know. So the point is, some people are extrovert, some people are introvert. So each of us have a personality. Some people may be very sensitive, some people may be very hardy, some people may have very low frustration tolerance, some people may lose their temper easily. So each of us have a different personality. Looking at the personality is also very important. So all this time I spoke about diagnosis. So then here, first of all, you see that whether it is some cancer in an early stage or a risk of cancer is important. That time we can give a lot of healthy lifestyle, recurring process and all. If at all they are already diagnosed with cancer and they have survived the cancer, there are two types. One is palliative terminal. Palliative is certain cancers have something like very grave prognosis, poor prognosis, but still there is something called as palliative care. Okay. In palliative care, what are we doing? Okay. Next. So once the cancer is diagnosed, how it happens, how we there is something called as existential anxiety, existential fear. There are a lot of theories about existential. Like we are born, okay, and we all know the only truth is death. But every day we have a fear when we will die. We know that one day we will definitely die, but still the fear of death is always there. The father of psychiatry is Sigmund Freud. Sigmund Freud gave instinct theory. What is instinct theory? There are two types of instinct. One is eros, one is thanatos. What is eros means? Towards life. Thanatos is towards death. Thanos means death. So certain habits what we follow, right, like exercise, having a healthy lifestyle, healthy diet, that is all eros means towards. Thanatos is driving very fast, daily drinking, binging with alcohol. All these things are the death instinct. It always predicts death. So, suffering such as cancer reveals some deep but enduring existential fear that all humans must face. So, already we are born with the fear that we are always with the fear that death is somewhere in the near or somewhere around the corner. When these kind of dreaded diagnoses happen, then that becomes more common. And we'll one day die, the world is largely outside of our control. We are all fundamentally isolated from one another, and we have to figure out our identities in an ever-changing world. Like, yes, we have parents, we have children, but all these things are to a certain extent. But we are all individuals. Living, like, this is that existential fear became very, very prominent during COVID-19 pandemic. During COVID-19, all of us, tell me one person raise your hand who never felt there is death near around us. Every one of us first understood there is something called as death and no one will be with us. That is the one thing which proved in COVID-19. Because so many people, like once you are admitted, you don't know whether you are who is with you. You are always isolated, and if you are dead, also whether someone will take your body also was a question. That was the real time when we really told we are. So suffering is not something that we can work over, outmuscle or dominate through sheer force of will. We think when we used to talk to patients during COVID-19 pandemic, everyone used to tell us, improve their willpower, make them strong, make them stable. Like every day we used to wear that PPE and go inside. We used to see the there were 20 beds in our medical intensive unit here. And the first bed, always the most impatient will be in the first bed. The next bed person will be seeing that one. Next day is gone. So what is the willpower will help you? Like I was witnessing, there were 3 doctors in the first wave who were admitted in our hospital. First bed, the first day gone. The second bed occupied that. So everyone in the second bed always had the fear. Can it be next? What willpower you will? So somewhere cancer or pandemic, these are some things which is always around the corner. That's why I appreciate Madam giving us a chance to make society prepared for the future pandemic. What is this future pandemic? See, we all tell that COVID-19 is a pandemic. We have heard suicide from the ages of Mahabharata. That is the biggest pandemic. No one have addressed that. Like every day you see, every minute one person commits suicide. But no one has addressed that suicide till now. Loneliness. You'll be seeing off late so many young youngsters are here. You are the generation, nursing students are here. You are the generation who got the access of your mobile. When did you get the access of mobile? When it bought it? That's the moment. Anyone? You're all in first, second, third, or fourth year of your nursing, right? Right? So all of you may be less than 20 years old, right? Near 20 or around 20, correct? So probably all of you are born after 2000. And mobiles became more prominent when you are 4 or 5 years of age, right? So almost within 8 or 9 years, you had touched the mobile. Correct or wrong? So this loneliness increased because of gadgets. Every time when we were kids, Madam, there are so many of you are here. Every time we used to play cricket or something on the road, every day the neighbors used to abuse us badly. Why are you playing in the road? Like now, even you call children, they'll not. Because they don't want, they are always the gadget. That is one thing which is because this loneliness, like I was just we attended a small conference on autism recently. There is a tribe near Bandipur. We have done a complete study of that Bandipur tribe. You heard about autism? You may be knowing what is autism. Autism is where children doesn't even have any social skills. If you call by their name, they don't even make an eye contact. Their language is delayed. Surprisingly, in that tribe, there are no autistic kids. So, why is this like? That's what made us really feel why, like, in the last 40 years, you know how much autism diagnosis has increased? Almost 20 times autism diagnosis has increased. When we started looking at that picture, that tribe, there is no partition between the house. Everyone can go anywhere. No autism. My parents belong to we settled down in Mysore from my father's generation. Before that and all, we were by farmers by occupation. So, when I used to visit my village during my summer vacation or Dasara vacation, there are so many people in the village, and everyone used to come to each other's house without any hesitation. I had never seen an autistic kid in my village till now also. If you go to my village, no one is there in the outside. That time, many people used to lie down on the veranda because so many people used to be in the veranda. But that loneliness has become so much now. If at all some person is having any suffering, maybe cancer, maybe anything, just talking, being with people, that itself solves so many of the problems. Social isolation. I practiced in Agrahara, Madam was saying. There, yeah, like Mysore is called as the pensioner's paradise. Everyone of us know that. In all the houses, very huge houses, only either one person 70 years or a couple in the age group of 70 years. If no one is there. Big houses, they have lot of money. Only point is moment. That social isolation. They are also sure even if they die, their children will come only after 2 days. Their dead body should be preserved in cold storage. So that social isolation is the one which is causing lot of problems. As I told, the original pandemic is nothing like original pandemic is the depression. Original pandemic is social isolation. Original pandemic is like we are all very proud to be an Indian because of our family system. I see in my clinic daily at least 2 or 3 diversities. Once recently, the month of October, one of my patients was they had applied for divorce and they were having some conflict. So the judge had called me to give an evidence for that girl. First day I went, they made me wait for 3 hours. Then the advocate was sick, so he did not. Second day also I had to go there. Every day in Jainagar there is a family court. In the second floor is the family court. And so many people were looking at me like an alien. Why this idiot has come here, coming alone? What is he doing? So they were looking at me strangely. After some time, one fellow came and started speaking. He gave me a wonderful knowledge about the. He comes from Coorg district, and he gave me a real picture what is the society. He quoted one example, sir. One earlier, like he has become so acquainted to the followings of the court proceeding. He was giving me an example. Sir, like there was one couple who came here. They struggled, fought for one problem that she scolds him or some small problem. They spent around 30 lakhs paying this lawyer, that lawyer. Finally, the client told, you send my wife, I'll take her back. After spending 13 lakhs. So, somewhere, our problem is like I just thought I should write a book of 2 days experience because so much I heard. There are small issues and somewhere where are we going? Like I always tell you, who is an expert? Expert is someone who tells that how you should learn is from this expert, how we should not behave. During COVID-19 meeting, everyone became an expert. So many things. Every day they will tell something. Like morning till night, we used to work and come. Then switch on the TV. Some idiot who doesn't know anything, he used to give 7 hours together on the television. What is this? 1 followed by 30. How do you spell it? How do you? It is $1 trillion. Okay, $1 trillion is the law. This is not my data. It is something which is given in World Economic Forum, which was held in 2018, where they found we are losing $1 trillion because of mental illness. We have 2 eyes, one mouth, 2 hands, 2 legs. If at all our one eye doesn't work, we can work with the other. If at all one leg doesn't work, at least we can limp and work. But we have only one leg. If it doesn't work, nothing works. So I always tell our mind is like a central processing unit. Like the central processing unit is somewhere here. Like if at all you have a wonderful screen also, our body is green. You are a healthy, flat, everything. It is only a TV until unless there is a CPU. That's where the most important problem we have is about this mental problem. So, what are the factors which are causing lots of problems, lot of climate change, overcrowding? Like city, everyone is coming and settling in the city. Don't know reason why. They feel that once they come to the city, take a pulsar bike, won't eat in that McDonald's. That is the greatest achievement. So I always tell someone who comes from a farming profession, I always encourage them. You are the king there. You order. Why you come here? Every city is getting overcrowded. Every city is so much polluted because of so many vehicles. That itself can cause anxiety. And you know that now India is the most populated country. You have read all the newspapers. Everyone tells we want second child. Because having the second child itself causes lot of anxiety. So what works for you? Like when any cancer maybe or any of the disease, first of all, you should acknowledge what's happening with you. Like sometimes we will be in the denial. Okay, you're diagnosed with something. Like thyroid disease, someone is diagnosed. They start becoming irritable, start becoming very upset or wrong. But first of all, acknowledge what is going on. Then invest. What is investment? Invest time in understanding what's happening with you and practice what works for you. So, how to develop this sort of hardiness or resilience? See, these are two people whom I always quote in most of my this person is known on India. He is Marcus Aurelius. So why we have put this picture is that this Marcus Aurelius is a Roman emperor. He in almost 2000 AD. This Marcus Aurelius had the Greeks had attacked from the border. He wins the war, comes back. After that, there was the worst pandemic called that plague. Even that is the bubonic plague was more recent one. That Bhairappa's novel you would have read how the plague had affected. Bhairappa's right. Whole bullock cart full of dead bodies used to go, and by the time the bullock cart returns, another bullock cart full of dead bodies were ready. That was the problem they faced during that time. So, though he is an emperor, he had a lung infection even from his childhood. And he comes to, after winning the war, he comes to Rome. Then he starts having so many difficulties. He could have gone to his house and slept well, but he did not do that. And he was the one who started following this donor saint. He gave the concept of stoicism. Stoicism is something. What is stoic in English is being stable or not reacting to the situation. So, the best stoic I have seen is Dharmaraja in Mahabharata. He is the one who never reacts to anything. So in 180 AD, so what humans do is that we always presume worst case scenario. Like someone was asking. Sorry, like I'm quoting this example, not to offend anyone. When there is a small, like I have a small ward here. Okay, that what is the ward? It is like some people tell go to Nanjangud, just take a go in front of that card, Nanjangud, go. But that is a ward. That's all. Like this is someone. Some people start imagining this what will become a tumor becomes cancer, cancer becomes. That's how human beings are. So we always imagine worst case scenario. At the same time, humans are adaptable. Okay. Like we are having the trio structure. We have 3 layers in your brain. Or the first layer is the mammalian, reptilian, mammalian, UOM. We are the one who can learn from mistake, but most of the time we behave like animals because we never learn from our mistake. Okay. So, how I always give a new thing is here. Because what we do is whenever there is something. There is a false evidence. For example, I am having a wall here. That is the false evidence that there is no cancer. But I start thinking it is real. So my new full form of here is false evidence appearing real. This is my own. So how do we respond to these things? One thing is we respond according to our personality. Like how we are, what is our mood state? Like sometimes like our mood is always color the situation. How does it color? If I am very happy, one of you come and slap me at a work, you slap go. But if at all I am not in a good mood, someone comments on my hairstyle in a slap. So it is the mood which colors the situation. That's where the mental health makes a huge difference. OCD is something where we think something, we know that it's our own thought, keeps on coming 100 times. You know that it is your own thought, you know that it is irrelevant, but it keeps on coming. This is doom scrolling. Doom scrolling is this what is the what? But I know that if someone has told me this award, it will not go, you shut your mouth and go to your goal. But what I will do, what are the chances of what becoming a cancer? There is some 0.000000008% that it becomes a cancer. So I always pick the mobile, only scroll the information which always supports my false perception. That is called as doom scrolling. That has become very common now. Colleagues are sometimes very dangerous. They always tell every time when you come, well, what man, what is becoming big? Let us not know. That is where the problem starts. Media. Wow. Media is the best thing. Media is like someone commits suicide and they'll put a black strip on the eye, but keep focusing that 100 or 1,000 times. The person who is already being mentally still do this. So expert, as I told, the experts are the ones who always tell us how we should not. So what happens during cancer is health is not something not mere absence or mere health is physical, mental, social, well. So what is this physical, mental, social, emotional, spiritual well-being? Hence, like if you want to be physically healthy, what is physical health? I can walk, I can kick, I can stand. Okay. All these I'm doing, eating well, sleeping at home, am I healthy? Not working at all. So, if at all you want to be physically healthy, you should be mentally strong. Mentally strong means you should work, you should have some concentration. Like when you are mentally health only, physical health comes. Then what is social health? Social health is like all of you are there. Like how much time you are with people. Apart from 8 hours of sleeping, apart from eating and going to bathroom, all the 2/3 of your life you are with someone. Either you are with your colleagues, your friends, or your parents, or your spouse, or anyone. So, if at all you want to be happy, the biggest denominator is the others. Your happiness quotient depends on others. Okay, many married people understand happiness quotient depends how you are feeling. How are you with her? Okay, so that is social. Social being is like how you are like when you are good with others only you are mentally strong. Okay, if you want to be socially better, how? Because spirituality is something which I always talk about. Spirituality is not something like someone going to Kailas and sitting with a big ponytail on his head. So that is not. I always talk spirituality. I always refer to this lotus. You have seen lotus, everyone? Where does lotus stay? What water? Dirty water. Exactly. The dirty water, but still it is so beautiful. Still it spreads its beauty. Neither the lotus is coming from the dirty water, nor it is stopping from spreading its beauty. That is spirituality, where you are with everyone, but at the same time, you are not bothering others or bothering yourself, and you are stable. That is spirituality. When you are spiritual, you are socially better. When you are socially, your emotions are better. When your emotions are better, your mental health is better. When your mental health is better, physical health is also better. What happens in cancer is that, first of all, the physical thing gets compromised. Okay. When the physical health gets compromised, your security reasons start getting affected. What is my future? How will I live? Then, because most of the people, they start thinking, will I become dependent? Who will take care of me? That is that social thing gets affected. Then I had told you existence. What is the meaning of my existence? How can I find the meaning at this point of time? What is the essence of my life? Why should I live? The question comes is, with all this physical abnormality, why should I live? What is the reason I should live? Here comes the biggest question of stress. Okay. The stress is so phenomenal. Stress is something, what is stress is what arises and something we care about is at stake. What is we care about our life when it is at stake, that causes lots of problems. When you are stressed, you get something like anxiety. What is anxiety? It is the best described that unhelpful thinking patterns we experience when our mind fixates with threat, uncertainty, and negativity. Okay. There is something there fearing. There is so uncertain about the future. Always these negative thoughts prevail in our body. So, what to do next? So, how to overcome? One of the things is action bias. What is action bias? People always believe that actions solve problems. It's like sometimes someone is diagnosed with some disease. Someone will come and tell you go to that place near Tamil Nadu. You cut some goat sheep, that will solve. So everyone will go there. What is the fear of missing out something? Everyone goes, I will also go. So confirmation, search and acknowledge of that support or belief. Like doctors or someone who told that this is the survival, you will survive. But the problem is we get the thought and we keep looking at the evidences which are problem. So threat scanning. What is this threat scanning? Threat scanning is like there is small tumor and it is normal. Doctor has advised that we will have to look after 6 months. But somewhere here, because of cold, there is something rough skin. Rough skin is a manifestation. Always something important. That is threat scanning. Then catastrophizing. There is a tumor. The tumor is very normal, nothing has happened, but like suddenly there is some shake in that tumor. Oh, it has become like catastrophe is a kind of Brahma Kannada they is saying and hypothetical thinking. Like so this tumor, like this tumor becoming a cancer is 0.008%. So in 0.008%, it may be one that hypothetically always thinking. Then other thing is emotional reasoning. One day they are going, suddenly your cat comes. Then today cancer becomes more person. So many times these are the things which causes lot of distress. So So basically, so much of problems are there, but awareness is like, what is this? Very good. Tip of iceberg, but we never look at the problem of stress. We never look at the problem, mental problems. Like many times, many people doesn't survive because they never acknowledge what they are going through. Like even doctors, they never address what is your problem. They only today chemotherapy work go. So what has happened? What they are telling? So first of all, we should please ask them how are you feeling. Ask them to tell how to acknowledge their stress, and you should own your stress. Means like stress has come to me. It is my own stress, and I should use this stress somehow. There is something called post-traumatic growth. What is post-traumatic growth? Means that there is some very horrible physical illness happened, but after that they grow better. Like many people who had COVID-19 and some people became very deteriorated. There are few individuals they give better after that pandemic. Because of so much of stress, so much of trauma, they started improving. How did they improve? What is this resilience? Resilience is a crucial statement. If at all we define resilience, it is the ability to bounce back productively during stressful situations. I was talking about the concept. The same thing applies here. It is in the anxiety diagnosis, a lot of anxiety. The basic factor which can help them get this one. So it will make you adapt to that excellent. Not only can, if once cancer comes, can't do anything rather than doing that. Like somewhere we are working on something called as resilience in every individual. Like why? Like you could have seen in the newspaper, the child asked for a mobile, mother didn't give, she hanged herself. Most of you have read that news on newspaper. So all these things, why it is happening is because of their lack of hardiness. They are unable to face the failure. Not getting the mobile is like failure. Not getting a chocolate is a failure. Not getting a rank is a failure. They are not addressing that. Not able to handle the biggest protector in this resilience. So how to develop resilience is the question. So if you want, you can't go outside, go inside. What is this? Like when I was doing my post-graduation, we were all that time around 25, 26 years old, and there were a lot of MBBS students. Our professor used to tell every time that Shivanand, you can take class. Like I always wanted to impress by teaching so many girls, but our professor never allowed me to go. Every time he used to tell, you go, then Shivanand, you see that case, I'll. So always I used to overcare. Used to tell always look inside. Like one, I always had some sort of negative feelings about my professor. And one undergraduate, he used to come and tell, sir, that is telling to look inside and this. So what is looking inside means? It is about looking. Like if you want to be happy, it is not from outside. It is from inside. How to be happy from inside? There are some 5 steps I want to tell you how to develop this. First thing is start the day with the intention. What is starting the day with the intention is? Like when morning we get up, we had kept the alarm at 6 o'clock. We got up at 7 o'clock. But we always start complaining today something will happen. God, I got up at 7 o'clock. Don't do that. Just keep your mobile in aeroplane mode. Keep 2 alarms. One alarm at 5 minutes, other alarm at 10 minutes. The first 5 minutes, just close your eyes. I'm not telling you to meditate. Please don't do that. Just close your eyes, and then once you close your eyes, so many things will start coming. yesterday for our voice. One girl you are seeing, but he didn't respond. So many things thoughts like that. Or at our colleague or HOD what he did, or our colleague what he did. So many things will be coming. So many thoughts will come. At the end of 5 minutes, the alarm it will ring. After that, he just tells stop. Okay. And next 5 minutes, what you should do? The next see, whenever we take mobile, we always look at what. Yeah. WhatsApp. Okay. When you are purchasing a mobile, what are you look for? One is camera, how many megapixels, other things. RAM, ROM, very. So we always look at a mobile, 6 GB RAM, 128 GB ROM, 512 GB ROM, something like that, right? So our brain is also a computer. You know that? And what is the capacity of your brain? 5,862 GB RAM. 5,862 GB RAM. Like when I was in after my +2, before joining MBBS, I joined a program called C program. I think it's outdated now. Like in C program, we used to feed the computer. A plus B whole square is already we have got the output. That's how we used to do. I think some people who have learned C programming may be going. Our brain works for that C program. Where the next 5 minutes, first 5 minutes, so many girlfriend, boyfriend, colleagues, so many things will come. After 5 minutes, stop. After that, program your brain the whole day and the whole day harmonious. Whole day I am positive. Try that, really best. It may be a very simple thing. It is like you start it, that will make you better. Okay. So no one can make you happy until you are happy with each other. The second thing is stay in the moment. Why you should stay in the moment? Like even in cancer patients, always they look at the worst case scenario. For example, so many nursing students are there. Your tutor comes. That day you are not like they do a lot of work. I have seen our nursing students. You are also mission hospital, right? Like mission hospital has set the highest standard in nursing. Actually, even in the different countries, their nursing teaching has been so much appreciated. The discipline they do, the discipline they learn in mission hospital is fundamental. So, once you go there, you have not made a side effect. The first thought, what it comes, today I will get reprimanded, right? You always think that today there will be a different reprimand from the teacher or tutor. So, from that time you will become very irritable, like this, and like this. You are so anxious, and finally there will be 10 assignments. Like the possibility of you getting asked and scolded is how much 1 in 10. So because you are doing all these movements, then only they'll catch you. So that's why first of all you should think other possible outcomes what are. Yeah, the 10% of chance only your teacher is asked. So limit the amount of energy spent on speculation. Like what you do, you start thinking, then she quiet, just me, she will scold me. Next time my girlfriend is standing in front, first she will call me. That will be my situation next day. So we'll teach about this lot. And once she scolds, will I cry? Will I retaliate? Only catastrophizing. I told you, like Vandana Kaibrama. So that's how our brain is pure. Is that the majority of our energy we spend on worrying something that has only a small chance of 10% chance only is happening, but we only worry about it. There may be other possible outcomes and choices at your disposal. Point in cancer also, there are we are all doctors, but not God. Yeah. Many times in way back in 2000, well, I was working in Bangalore in Manipal Hospital, and one engineering girl, by she was studying in Surya, and they had told me that she came in a very bad situation. Like she was like, there's something called as catatonia in our psychiatry, where they'll stand like this for hours together. You put them in any position, they'll maintain the same position. The major cause for catatonia is schizophrenia. So that girl, she was in her second year of her engineering. Their parents brought her. They saw her, and we gave one lorazepam injection that solves it very fast. Then they were very surprised that girl was like this. Within one injection, she became all right. But I gave them a very clear prognosis that it is a lifelong illness. It will never be cured. That is or that. Because we like as doctor, we should give the real case scenario. But actually, after I left Bangalore in 2013, came to Mysore, and 2016, her better than uncle, like a pharmacy professor in Bangalore, somehow he could catch my address and came and gave that invitation that his daughter is getting married and she's absolutely normal. So I'm not a god. I have told something what I know, what I have read. But she's absolutely fine. She has 2 children now. She's a software engineer, working wonderfully well without any medicine. So sometimes what we do is we always imagine some worst case scenarios and get drilled in them. Yes, these are some things we tell what literature we know about. There are something beyond that. That's where so always I love the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So many things we cannot change. Many things we can change. So, what all things we can change, let us change. Some things we cannot change, we can't change and keep quiet. We should always have the wisdom so that we can differentiate between them and we can manage well. So, focus on what we can control. For example, humor growth. Who can control that? We can't control it. What happens to Ukraine can we control? No. What Russia's decision on Ukraine can we control? There is always one joke many people tell. There was a couple. They had led the life for 30 years, and when I asked a question to the husband, "Who are you so cordial?" He told like, "Sir, big decisions I take. Smaller decisions my wife takes." So, what are the big decisions? Whether this World Cup will be won by Portuguese or Croatia, or who will win the war, Spain or Russia? Then what are the small decisions? Which school child should go? Tomorrow's breakfast. These decisions will be taken by me. So that's why they are very happy, very frustrated. So similarly, there are so many things we can't control. Certain things we can control. Let us look at the things which we can control. Like one thing is the humor progress we can't control. Humor, what happens, it is its own decision. So what we can do, we can be happy. How can be happy? Like develop some hobbies. What happens is, biggest problem with all of us is that we are all very workaholic. It's like morning, 6 o'clock get up, 8:30 go to the hospital, 8:30 to 4:00 in the hospital, 4 o'clock come back again. That we become like a machine round the clock. But what we have forgotten. Like all of us are born, I am born as Shivan and Madam is born as Shivan. So after that we become a son or a daughter, then we become sister or brother, then we become wife or husband, then we become mother or father. But where is Shivan or where is Mani? Where is biggest problem with all of us is that somewhere we lose poverty. We take the secondary identities as a son, father, or a brother, or doctor or psychiatrist. These are all our secondary identity. Or primary identity, what it is we forget. Most of you, there are adults, youngsters are there. As children, you would have played something very good. You would have sung something. You would have played something better. But we forget that. That is the thing which gave us a lot of happiness. But we never follow that. We take our different path and always we are in that running machines. So the biggest thing is you should find what works for you. Okay. So like focus on what you control. Means like for example, many a times there is something called as third person talk. For example, today was just a situation, not to offend anyone. Like madam had called me. I had one ECT. I told madam I am having an ECT. I'll come to after some time. At the same time, there was some research work going on. The ECT fellow had come very late. Anesthetist was very offended that he came late. He was in some other case. So there were some query things together. And one of my students came. At that point of time, I wanted to shout at him because I don't know, like I had given him my work yesterday and he had brought to show it to me. Then I just thought what I am doing. Why I am so much misunderstood. Then I understood I don't know what to do at that time. First of all, the third person talking is like, why are you crazy now? First question. What is bothering you? But all you understand what is, if you talk to yourself, what is happening to you, Shivanand? First, I am feeling confused. What is causing you confusion now? Second, then you will understand you are not able to manage this. The third thing, I always tell something called as a triad system. What is triad system? It's like when our casualties there, I mean emergency department, like we can manage 5 to 6 at a time. There is a huge bus accident happening. There are some 40 injuries happening. So everyone will come to our emergency department at level 30 at the bed. So what we do is like we see everyone in the row. Okay, we have some 3 cards, red, yellow, green. Okay. So what we do, one person will give red card, yellow card, green card. What does that mean? Like the red card is given to someone who should be attended immediately. Yellow card is we can attend even after half an hour. Green card, even if we don't attend, we will not have any. Similarly, we should have a triad system. Like when you are very much occupied, when you are so anxious, then you understand so many works I want to do now. That is the time you should prioritize your work. Now, I wanted to come here. That is the first priority. You do that. Then I told I have a talk. I'll come back and talk. Go. Otherwise, if I had shouted at her, one thing I would have felt guilty. She would have felt, what is this fellow psychiatrist? He should be trained. So that's there. So you should always have that, and you should have some goals in that that generate a sense of accomplishment. Must be different or positive such as joy, especially good success. What is this? Basically, our accomplishment as an individualist. Then in your profession, you want to, now you are a nursing student, then you become a nursing staff, then you want to go to some other earn more. That is a different accomplishment. There is something called as personal accomplishment. Maybe like during the COVID-19 pandemic only, I realized something which gives me happiness. I never cooked in my life. So something but keeps you happy. And the other thing, best thing what you can do, you can always control your eating. These are something. See, ignore the noise. Always we are important, right? But we always give importance to others first. We know that we are important, but we always look at if someone tells that you have become very weak, it's not what some cancer has happened. Some if you become fat, people will come and tell, oh, you are so fat. Again, you start thinking, did I develop that? So please look at yourself, ignore the noise. So rein your emotions. Like physical activity is very, very important. That is what our Indians we are missing. We are the land with yoga to the world, but we never practice it. I don't know why all of us are so reluctant to practice physical exercise. Because when I was a student, when I was in primary school, every Saturday would be in the morning, the first class will be the physical activity class. And every time they'll make stand like that. If I leave it, someone will come down they'll be waiting. So I don't know whether that has caused this aversion to physical activity, but still physical activity, whether they are cancer, any disease, very, very important. Like physical activity, the one that give you a lot of endorphins in the brain. Even lots of antidepressant will give, doesn't give this endorphins. Endorphins are the one which keeps you very happy and healthy. So physical activity is one thing which always be missed. So this is the thing where if you do walking every day, it can reduce your brain stroke by 20%, heart attack by almost 30 to 40%, the bone fractures up to 48%, the femur fracture, your longevity, 75 minutes of walking, brisk walking in a week can increase your longevity. Your depression mood, 30 minutes of walk every day can reduce the symptoms of depression by 20%. So somewhere I don't know why, including me, we always find some reasons to avoid physical activity. Yesterday I slept at 11. Today, or else today I have so much of work in the office, so I work and physical activity. What is the relationship? But we keep on finding reasons to be not physically active. So, what are the ways we manage stress? A good regular diet. Please avoid those junk foods like McDonald's, Domino's. They are the ones that give you a lot of fat. And seek help from mental health workers if all you are having problem. Some small stress relaxing exercises would help. Mindfulness. This is one thing. Last thing. Because already in this time, it's already 1:45. Last thing about mindfulness, we'll stop it. Okay. Mindfulness is something which I always talk to people and want people to do it. We always think meditation is something like this. I should not get any thought. Not getting any thoughts is a thought. I should not get any thoughts is a thought. So this mindfulness is a very simple meditation technique, which is given by Gautama Buddha. This is actually Vipassana meditation, and the Americans have taken it and made it the patent given back mindfulness meditation. What is this mindfulness? Is like I am talking to you. Okay. That light is coming and going because the door is someone is opening the door, closing the door. Okay. Most of you would have heard that noise, but it would have come and gone. Only when I told, everyone will focus on the door again and again. That is our mind works. Every day we get around 15,000 to 30,000 thoughts. Which are the thoughts which will sustain your mind are the ones we give more focus on that. Focusing means either you are responding the thought or you are trying to stop that thought. Okay. Both is responding. What mindfulness does is that you are just observing your thought as a silent spectator. How many of you follow cricket? Can you raise your hand? So many of us. Right. In cricket, there will be a commentary going on and someone is playing. Will the players listen to commentary and play? No. Mindfulness is like that. Here, players, our thoughts are commenting. So just observing our thoughts without any reaction to that is mindfulness. Like many times we sit to do mindfulness after 2 minutes, or like we keep an alarm for 10 minutes. After 2 minutes, we open our eyes, already 15 minutes, but it's only 30 seconds. It happens to everyone. Even 30 seconds is fine. If you have done for 30 seconds, I'm happy. The next time after 1 month, 30 seconds, at least you will become more for this has shown lot of benefits in so many diseases. Starting from, we did a study on irritable bowel syndrome, where once they eat suddenly they want to go to toilet. It's irritable bowel syndrome. So we have published it also. It works well. So when you go to mindfulness meditation, you always think that when you are meditating, it's like switching off the mobile. No, it's switching on the mobile. So don't go with any expectation. Yes, you want to sit and observe your thoughts. Okay, these are all some. If you take a photo of this, these are some things where you can just click on this thing. There, put your earphone. You can practice the mindfulness. The secret of happiness, whatever the cancer or anything, the secret of happiness is different. Like when you go to gym, you want to get muscles. Like what you do is you start first the muscles there, then it start reconstructing and give you a good. Like happiness is also a muscle. You should work. You should work for happiness. Once you work for happiness, you will always be happy. Thank you very much for giving me an opportunity for addressing you all. Thank you.
Thank you very much, sir, for Thank you very much, sir, for helping us become more aware of the problems and the ways we can help solve them. I request everyone to please join for lunch. You are free to interact or ask any queries during the break. Please assemble back in 30 minutes. We have the next talk on genetics of cancer by Professor Suturu Yasmani. Thank you.